Colombia and Brazil, I think time has come for all of us to synergize our efforts to seek official recognition for Ayurveda from the government of Argentina and the other countries in the region to facilitate its practice, import of necessary herbs to treat patients, and also grow many of these medicinal plants in Argentina. I will conclude with words from Ashtanga Hridayam, one of the most famous texts of Ayurveda. According to Ashtanga Hridayam, the poor, those suffering from disease, and those afflicted by sorrow should be helped. Even insects and ants should be treated with compassion, just as one's own self. This is the guiding spirit of Ayurveda. Let this be the guiding spirit for all of us. Last but not the least, I would like to take this opportunity to wish, on behalf of my embassy, my wife, Mrs. Seema Bhatia, who is an Ayurvedic practitioner, and my own behalf, a very happy and prosperous Diwali to all the participants and their families. Muchas gracias. Thank you. Dhanyavad.
Muchísimas gracias, Inés. Muchas gracias por las palabras, por el apoyo que nos has mantenido durante todo este tiempo. Muchas gracias.
Muchas gracias. Vamos a dar la bienvenida a Mr. Suresh Reddy. He is the ambassador that assumed the chair as ambassador of India to the Federative Republic of Brazil on September 19 of 2019. He has had a distinguished career since he joined the Indian Foreign Service in 1991. He has served in Cairo, Muscat, Abu Dhabi, and Islamabad, and later as India's ambassador to Iraq and ASEAN. Ambassador Reddy also served as a special envoy of Government of India to Iraq from June to December of 2014, addressing all issues relating to safety, welfare, and evaluation to Indian nationals. In the ministry, he has held sensitive and crucial positions, including as head of office of Minister of State for External Affairs, and has been engaged with the neighboring countries of Bangladesh, Myanmar, Sri Lanka, and the Maldives in different capacities, including as desk officer, director, and general director. He also established and headed the first ASEAN Multilateral Economic Relations Division, and in that capacity was instrumental in establishing the BIMSTEC Secretariat, while also looking after ASEAN, ACD, and APAC related issues. Ambassador Reddy head the Multilateral Economic Relations Division in the Ministry of External Affairs from December of 2018 to January of 2020, and was India's South Sherpa to G20, G7, BRICS, and IFSA. So since January 2020, deputed as Additional Secretary of Europe and was coordinating India's engagement with Europe and Central Asia. So welcome, Mr. Suresh Reddy, and thank you a lot for all the support that you gave us to the different projects and to set up this webinar.
Thank you, Dr. Natalia. I think next time I'm going to reduce my biodata, but thank you. I must really compliment this wonderful set of panelists, the wonderful set of practitioners who have come together today to promote Ayurveda, not only in the respective countries, but across the region. So I joined my colleague, Ambassador Bhatia, in thanking each and every one of you for this wonderful initiative. Thank you. And this is only possible, this promotion of Ayurveda is possible only with the support and help of the practitioners. And so I'm especially grateful for the academic consortium, from Brazil, with whom I've been working with, for also joining and taking this initiative. Thank you again to Dr. Ricardo Gelman. And as Ambassador Bhatia mentioned, I'm fortunate that the government of Brazil has recognized Ayurveda as one of the elements of treatment in the national healthcare system. And for this, I would again like to appreciate and welcome Dr. Daniel Amado today, and thank him for joining us, and also for all the support which he and the Brazilian Ministry of Health have been extending in promoting Ayurveda. Since 2017, Ayurveda has been one of the important practices under the public health system, the Sistema Único de Saúde of Brazil. And I believe this has not only enabled the patients to get the benefit, but importantly has provided the platform for promoting Ayurveda at a much larger scale. So thank you, sir. Thank you to the Ministry of Health for that. And I'm also glad to inform that we have many agreements which have been signed with Brazil, with the government of Brazil, including recently in January, early this year, when President Bolsonaro visited India. Agreements between our Ministry of Ayush and Ministry of Health of Brazil. We are also currently conducting many joint projects, including relating to treatment of COVID, and including not just treatment, but managing the effects of COVID, so to say. Now, what is interesting is that today, in the face of this pandemic, in this unprecedented challenge, which we have all been faced with, whether we are a developing country or whether we are a developed country, every country has equally faced this challenge, and I must say, not very successfully. But what is interesting is that everybody have gone back to Ayurveda. Everybody have gone back to Ayurveda, recognizing that this is perhaps the most holistic solution which is possible. Because Ayurveda, as it correctly is called, it's called the science of life. I mean, as you know better than me, that Ayur means life, and Veda is a science or knowledge of life. And so it is not surprising that after the pandemic, more and more people are turning to Ayurveda. And I believe in this context, I must appreciate two special, should I say, organizations. One is our own Ministry of Health. Ministry of Health, so I mean the Ministry of Ayush in India. I must really appreciate the outstanding work they are doing. Today, they have established very high standards and certification for both the practitioners and the products. They have entered into various agreements with various countries in promoting Ayurveda and helping to establish chairs on Ayurveda and conduct joint research. And you may be aware that our Prime Minister also dedicated 2 centers of excellence for Ayurveda yesterday in his speech on the occasion of the Ayurveda Day. And for which I'm really grateful to Ministry of Ayush for all the support they have been giving to us. And the other organization which I would like to appreciate is the consortium of the Ayurveda practitioners in Brazil. As I mentioned, Dr. Ricardo Gelman. And in this, I would also like to thank the Ayurveda Prema, Dr. Jorge Berra, for coming together and translating the guidelines which have been introduced by the protocol, the guidelines which have been introduced by Ministry of Ayush for treatment of the COVID. This, I believe, has really enabled everybody to get benefit of it. This has also made people who are already aware of the importance of health. Today, because of the pandemic, everybody is aware of the importance and the critical role played by health. But this has also enabled them to realize the need for building up the natural immunity in the body. And the natural immunity in the body can be built up only by practicing natural medicine. And that is where this protocol comes into play. And so again, I would like to compliment and thank Dr. Ricardo Gelman and the members of the academic consortium, and of course, Dr. Jorge Berra for taking this initiative. And I think with this, I'm looking forward to listening to the other distinguished speakers. Thank you very much for giving us this opportunity and inviting me to this event.
Natalia.
Thank you a lot for your words. And so now we welcome to Ricardo Gelman. Ricardo, te damos la bienvenida como director del Consorcio Académico Brasilero de Salud Integrativa, quien en compañía de los delegados del CAPCIN y de la Fundación Ayurveda Prema, encabezada por Jorge Berra, nos tienen un anuncio para compartir. Una sorpresa para compartir.
Graças, Natália. Bom dia, boa tarde, boa noite para todos. É uma honra participar. Gostaria de cumprimentar, em primeiro lugar, o embaixador Suresh Reddy, de Brasil, de Nisbate de Argentina, Uruguai e Paraguai, por apoio em todo esse processo, e gostaria de trazer uma notícia muito importante para celebrar o dia de hoje, que é o lançamento do livro que traduz para o português e espanhol as orientações, os guias e os protocolos para o enfrentamento de Covid a partir dos guidelines do Ministério AYUSH. Então, gostaríamos de agradecer todo esse trabalho muito importante do Ministério AYUSH, que é a colaboração das embaixadas de Brasil, Argentina, Uruguai e Paraguai, com a Fundação Prema e o consórcio acadêmico brasileiro. Pudemos lograr lançar hoje oficialmente esse livro para todos os países de língua portuguesa e espanhola. Então, Nina, por favor, que está coordenando conosco esse livro, poderia apresentar os slides, por favor? Compartilhar a tela. Gostaríamos também de anunciar que decidimos, ayer, em uma assembleia de consórcio acadêmico em Brasil, criar um comitê de Ayurveda, que é um comitê com características latino-americanas, porque a professora Nina Silva será a coordenadora e professor Jorge Berra, também coordenador, juntos desse comitê. E, então, é um momento muito importante para a reunião, e esse trabalho é como o primeiro desse comitê.
Tá vendo, Ricardo, a tela?
The mission of the Brazilian Academic Consortium is to contribute to the scientific validation of integrative and complementary approach in health through the systematization and production of studies and research, increasing the visibility of scientific knowledge in the area and promoting exchange and collaborations between researchers, universities, and national and international research groups to support the implementation of the traditional complementary integrative medicine, that naming PICS in Brazilian ministry, in an integrated manner with the public health system. Next, please. Then, beside the 4 committees that you have already developed, devoted to pain, natural products, integrative pediatrics, and integrative oncology, we would like to launch our specific committee to Ayurveda today. And the first product of that committee that engage a Latin American group connected with the TCIM, the Traditional Complementary Integrative Medicine Americas network, as a whole to their committee. Next, please. Then without the Prema Ayurvedic Foundation, it could be impossible to spread beside the Brazilian Portuguese language. Then we're working together. Then I ask to Dra. Nina to continue the presentation as the leader of that committee from the Brazilian Academic Consortium. And thank you very much.
Obrigada, Ricardo. Bom dia a todos, boa tarde, boa noite, good morning, everyone. É um prazer poder estar aqui apresentando hoje o resultado desse esforço coletivo de um grupo muito unido que produziu aí o consolidado de guias e protocolos traduzidos, que foram produzidos pelo Ministério do AYUSH para o enfrentamento do COVID-19, usando através do Ayurveda. Então, esse grupo que o Dr. Ricardo já apresentou, ele traduziu os 4 últimos protocolos e guias, que vocês podem ver aí na tela, disponíveis no site do Ministério AYUSH, e produziu em português, e em espanhol, todo o consolidado dessas normas, não apenas fazendo a tradução dos documentos originais, mas também incluindo alguns apêndices que contextualizam o Ayurveda dentro do Brasil e da Argentina, como uma tentativa de trazer o Ayurveda para uma realidade local nos países já mencionados. Esse aqui é o grupo que trabalhou para a construção desse e-book, desse livro digital, em tempo recorde, que sem o apoio da embaixada também não seria possível ter sido realizado. Então, aqui a gente tem o prefácio do material em português, que vai ficar disponível depois para download, todo o material que foi produzido, a tradução, para vocês poderem ter uma ideia do conteúdo, né? A gente traduziu toda a parte textual, toda a parte gráfica do material para inglês, para português e espanhol, junto com a Fundação Ayurveda Prema, na Argentina. E, como eu falei, um dos materiais produzidos pelo grupo para a contextualização da Ayurveda nos países, né, no Brasil e na Argentina, foi, por exemplo, uma relação de plantas que são citadas nos documentos, para a gente saber se elas são encontradas no Brasil e na Argentina e como são encontradas. Se ocorrem de maneira espontânea ou cultivada no país, se podem ser obtidas através de farmácias de manipulação ou se podem ser obtidas através do comércio autorizado desse material pelos respectivos órgãos sanitários e de saúde nos respectivos países. Então, a gente fez essa tabela mostrando como algumas plantas a gente encontra no Brasil, na Argentina e na Índia, e outras apenas na Índia. A gente também ilustrou, fez uma seleção. Foi difícil fazer a seleção das plantas para ilustrar, mas a gente também produziu pranchas com algumas fotos das plantas que são comuns a Brasil, Argentina e Índia, e algumas plantas que só são encontradas, pelo menos disponíveis para acesso do público, na Índia, né? Aqui no Brasil a gente não consegue de alguma forma. Então, aqui é o grupo do Brasil que trabalhou nesse material para produzir esse e-book. Então, temos toda a equipe brasileira que trabalhou.
Jorge, essa equipe, Nina, essa equipe dos autores, Jorge Beira também.
A equipe dos autores, são tantas pessoas, né? A gente está trabalhando assim há 3 semanas nisso aqui. Na verdade, tem muitas pessoas envolvidas para que isso pudesse se concretizar de maneira assim tão rápida. Então, aqui são os autores do material em português. Eu, a Bárbara, o Caio, o Ricardo, o Danilo Maciel, Danilo Santelha, Jorge Torruguet e o Ricardo Guelman. São os autores do material em português. E aqui a equipe da Argentina. Acho que Jorge pode falar más sobre ahí.
La verdad muchísimas gracias, Nina. Ha sido un gusto y verdaderamente hemos trabajado codo a codo y de manera muy armónica, muy fluida, muy intensa entre el Consorcio Académico Brasileño de Salud Integrativa y la Fundación de Salud Ayurveda Prema. Quiero destacar que de este trabajo, por ejemplo, de los documentos que ha generado el Ministerio de AYUSH, se mencionan 52 plantas medicinales. De esas 52 plantas medicinales, crecen de manera autóctona desde siempre o son cultivadas en la Argentina 40 de esas 52. 42 plantas medicinales se pueden conseguir como productos farmacéuticos magistrales y 48 de las 52 se comercializan de distintas maneras. Así que verdaderamente las normas del Ministerio de AYUSH son de aplicación fácil y concreta en nuestro ambiente latinoamericano, tanto en Brasil como en Argentina, como en todo Sudamérica. Desde ya, muchísimas gracias por todo el apoyo del Ministerio de AYUSH, de las embajadas respectivamente de la India en Brasil y en Argentina, y esto demuestra que frente al desastre de la pandemia, el trabajo en red, el trabajo en colaborativo, el trabajo acercando las propuestas de la medicina tradicional, puede servir como una forma de enfrentar y encontrar soluciones para todo esto que está enfrentando la humanidad. Muchas gracias a todos y particularmente también muchas gracias a los colaboradores. Y hay otra, acá está, hay otra y listo. Muchas gracias.
Graças, Roster. Muito obrigada. Bom, a gente realmente agradece a todos os envolvidos aqui no Brasil também, outras pessoas que estavam participando desse produto e, como já foi falado, a gente espera que esse material sirva para contribua, né, para a divulgação da Ayurveda nos países e de maneira que seja adequada à realidade local e possa contribuir para a gente enfrentar esse momento de tanta diversidade para todos nós. Então, Ricardo, todo mundo, muito obrigado.
Gostaria só de agregar que para esse livro os dois embaixadores, the two ambassadors included a letter, a beautiful letter for the book, and also from the Ministry of Health in Brazil, Daniel Amado wrote important forewords, a prefácio to that book beside the Prema and the Brazilian Consortium. Thank you very much. And it's just the beginning of an important collaboration in research and teaching. Thank you very much.
Bien. Queremos agradecer nuevamente a los dos embajadores su presencia y también señalar en este momento correspondía que estuviera el secretario de AYUSH, el doctor Rajesh Kotecha, una figura, un faro verdaderamente dentro del mundo de la Ayurveda. Me acaba de comunicar que por cuestiones de trabajo, de su trabajo como funcionario muy importante dentro del Ministerio de AYUSH, está en una zona con poca conectividad y ha designado como representante para que comparta su mensaje a la doctora Tanuja Nesari, así que voy a tener el gusto de presentarla, aparte de conocerla hace mucho tiempo, y quiero saludar tanto a la doctora Tanuja Nesari como al doctor Manoj, si está por ahí, que es el advisor de Ayurveda. Bien, para compartirles el currículum de la doctora Tanuja Nesari, ella se recibió, completó su especialidad y su doctorado en farmacología ayurvédica en la Gujarat Ayurved University en Jamnagar, que en el día de ayer fue declarado por el primer ministro de la India como Instituto de Importancia Nacional. Ha sido profesora universitaria durante 29 años, dirigiendo numerosos doctorados y proyectos de especialización. Ha trabajado en 21 trabajos de investigación clínica y ha publicado 74 trabajos científicos y ha participado como revisora en 91 artículos. Actualmente se destaca por ser la directora del All India Institute of Ayurveda en Nueva Delhi, donde también es profesora y jefa del Departamento de Farmacología y también jefa de la División de Investigación Translacional. Doctora Tanuja Nesari, verdaderamente un gusto tenerla acá junto con nosotros. Muchas gracias. Happy Diwali. Namaste to you. You must unmute your, yes.
Yeah. Namaste. Am I audible?
No, yes, perfect.
Yeah. Namaste. Wish you very, very happy Diwali. And thank you very much. And it's a great honor and the pleasure both to represent Ministry of Ayush and especially Secretary Vaidya Rajesh Kotecha. As he is not available, he is now, because of some unavoidable circumstances, he is in the remote place. So I had an honor to represent Ministry and the Secretary. Thank you, Dr. George Bera. And I really wish to welcome and thank Dr. Sri Dinesh Bhatia ji, Indian Embassy in Argentina, Mr. Suresh Reddy ji, Dr. Geeta Krishnan, Dr. John Permado, Daniel Amado, George Bera, and all distinguished dignitaries and the guests and the panelists who are sharing this platform. A very happy Diwali, and I congratulate on behalf of Ministry and the Secretary, and on myself, I congratulate the Traditional Complementary and Integrative Medicine Network of Americas in association with uh, Foundation de Salud Ayurveda Prema from Argentina and the Brazilian Academic Consortium of Integrative Health for organizing this event. This is really the need of the hour, coming together for exploring the potential of Ayush in the fight against this corona. May I share the screen? Dr. George Bera, I'm just trying to share the screen to share the activities of the Ayush Ministry in this COVID pandemic. I take this opportunity to share the presentation what Dr. Rajesh Kotejang was supposed to present, and it is Ayush Ministry strategies in the COVID-19 pandemic. May I proceed? Hello? Hello?
Yes, you can. You can.
Yeah.
We are hearing you.
Yeah.
Thank
Yes. So no interpretation. So shall I just proceed in English? Yes. So these are the ministries of Ayush. You may please tell me when shall I stop, please. And it is I'm really happy, and this ministry is really blessed to have the integration itself, because in this unprecedented time when the entire world is fighting against finding out the solution for the COVID-19, it is the Ministry of Ayush which had a integration with the Ministry of Health and Family Welfare. That's the conventional medicine, and we really had the join together to fight the COVID. But earlier it was Health and Family Welfare Ministry, and since 2014, I think this is the only ministry, only nation where there is a separate ministry for Ministry of Ayush. Ayurveda is a acronym for Ayurved, Unani, Yoga, Unani, Sovaripa, and Homeopathy, AYUSH, and also a Siddha. And the health promotion and treatment is the main aim of this system. Coming to the COVID-19, Ministry also had created a dedicated COVID dashboard where a day-to-day activity against the Ayush, against the COVID, and what are the day-to-day advisories, what are the research guidelines, practitioners guidelines, what are the drugs and the medicines to be taken, and many activities and the reference are day-to-day updated on the ministry's COVID-19 dashboard, and which can everyone see. And we are really happy that this ministry was the first ministry to notify the guidelines regarding the self-care measures and the immunity when the entire world was under lockdown and there was no access even for the medicines. Then this was the only ministry where we had declared and notified the immunity boosting measures. And following that, all the guidelines for the practitioners starting from Ayurveda, Unani, Yoga, Sovaripa, Naturopathy, and Siddha. These were the guidelines this was the consensual document which was prepared based on the traditional wisdom and the experiential basis of thousands of the physicians of the traditional medicine, and also having the experiential basis. And these guidelines are being practiced in many of these like 700,000, that's the 7 lakh practitioners across the India, we are blessed to have the licensed practitioner, and there is a parallel vertical where we are the registered practitioners, and they enjoy the right and the responsibilities of treatment with the traditional medicine. Not only this, the traditional medical doctors, all the Ayush doctors, 700,000, they were involved in training also and implementation of the protocol which was declared by Health Ministry of the social distancing, physical distancing and socially connect, then mask, hand sanitization. And to all of them, there was a lack of, like, more and more awareness was also given, sensitization and training program, they were involved, and then further the knowledge is disseminated. So since the coronavirus is a novel coronavirus, so all Ayush practitioners, they have played a vital role in communicating and creating awareness even into the periphery and rural India. And looking into the prevention, being the prevention is better than the cure. And if you look at what is the impact of this training awareness and the self-care advisories, if you look at the market trend, then you can see here there is more than 25% rise in the sale of all the preventive measures like Anutel, that's the physiological marks, nasal application, then the herbal tea, Giloy, that's the Tinospora cordifolia, and you can see Chyawanprash. So all those herbs and the herbal formulations, which are really very important as an immunomodulator, the market size within India and across India has been really increased to more than 25%. And the industrial growth also you can see pre-COVID. It was like the 23, and to some, like in Chyawanprash, it is more than 500% growth in the industry. And it's really like the small virus, tiny virus. It is the challenge, but it has the Ayush system consider this as an opportunity to promote the science for the sake of the public health and the community health, and that's we can really see from this. Following this, there was a standard treatment guideline which was declared and which was notified, which served not only to the prevention but management of the positive, asymptomatic, symptomatic, mild, moderate, and the severe cases with the holistic approach of Ayurveda, yoga, meditation, and diet and lifestyle, and which brings the harmony between mental health, physical health, and the spiritual wellness. And that is the what which is really useful in this unprecedented time. The advisory which was declared, which consists of the local measure, physical measure, and the general measure. And the physical measure, which we say that it's a nasal application and the gargling with turmeric, salt, and the warm water, that prevents the entry of the virus into the system. Once the virus enters, then the herbal tea with the antiviral herbs like spices, cinnamon, ginger, and all that helps in preventing the replication of the virus and also preventing the cytokine storm and the inflammatory cascades. And once the virus attacks, then all are rejuvenating and immunomodulatory herbs like ashwagandha, glycyrrhiza glabra, guduchi, and many others that really prevent the target organ damage. And that's how that has been measured by the Sanjeevani app. That's the ministry's IT backbone, really could really tap the responses of more than 100,000 population, 1.2% population with the research mode, and it says that more than 87%, that's not less number, but 87% of the Indian population now are using one or the other supporting immunomodulatory measure from Ayush system, may it be Ayurveda, maybe homeopathy, Unani, Siddha or homeopathy. That's really, and I'm really happy to say that because of Ministry of Ayush various initiative, even though the number of cases in India are rising fast, like we are number 2, but the cases which are the mortality is comparatively really very low, and 99% is the recovery rate. And today also, number of recovered cases are more than the number of daily infected cases. And that's only because of the deeply rooted traditional wisdom of Ayush systems and more promotive awareness which is created in this unprecedented time, and more public health and communities are really using this healthcare as a preventive and promotive and also as a adjuvant. And that's how as a preventive, curative and restorative care. And I also representing All India Institute of Ayurveda and as a heading as a director have a I'm really proud to say that we could use all these measures pre-COVID, post-COVID and during COVID management at All India Institute of Ayurveda, and the largest cohort, that's the 80,000 police personnel who are the frontline warriors, and we really give them the Ayur Raksha kit. That's the preventive kit. And what is the outcome? That really helped them to bring down their rate of infection daily as compared to Delhi's population and other metro cities, and the mortality rate was also comparatively less. Today it is 1.2 and in Delhi police it is 0.48, and that's only because of the preventive kit from the Ayush system. And now coming to regular hospital services at All India Institute of Ayurveda. Ayurveda says that this COVID is because of the disharmony between the external environment and the within the system, and the universal clock and the biological clock. There is a disharmony. And the classical wisdom tells, the experiential guidelines tells COVID as a Janapado Dhvams Vyadhi to use the Havar and herbal decoction. And you can see here the one, each and everyone who enters into the hospital, he receives the decoction. That's the what we really could prevent. All the healthcare workers, more than 500, the patients 2,000 daily, and all other patients also OPD to minimize the infection. And you can see in our COVID health center where the tagline is care with compassion. It's a difference that we say that we are physically distanced, minimum 2 meters, but socially connected, and that human touch, because patient carries a stigma, he feels himself that untouchable. But we say that we give them the more counseling, recreating activities, meditation and yoga, and that really he feels that I am with the family, and that sense of security, that's what we give in our care center as a compassion, and along with scientifically proven, because that's the modern Ayurveda hospital where all the immunological markers and all the RT-PCR and others are also being given. And you can see here that 380 patients which are treated, and 93% they got holistic Ayurveda and yoga and a treatment, and only 7% of the patient had integration, and only few of them we had to refer. And you can see out of 334, 331 are completely cured, COVID negative at the on the 10th day. And what is the outcome is the mean recovery time has been minimized from average, it was 16, earlier it was 25 in the hospitalization. So the mean recovery time has been reduced to average 7 to 9 days. And it's really a significant achievement, we can say. And you can see completely the healthcare workers who are deployed, it is a 0% infection, because healthcare workers, they are also using the holistic Ayurveda. And you can see we have the all ultra modern required oxygen support ICU. And we are thankful to Delhi government, Dr. Manchunda, and also Ministry of Ayush and Health Ministry, because all together it's a model of integration and model of holistic services. And you can see that each and every patient is being rewarded for successful completion and completing negative. You can see the mean recovery, average recovery time has been reduced. And coming to the National Clinical Management Protocol, what Secretary Ayush, it's a big achievement that it's really the significant achievement of the Ministry of Ayush based on the various successful experiences of integration of Ayush services. Then the Health Ministry has included Ayush practices and some of the Ayush formulations into National Management Protocol. And that's, I think it is not only now Ayurveda hospital or Ayush hospital, but all the hospital has got the access of using the Ayush services. And if we look at the research initiatives, because ministry constituted the interdisciplinary task force, and the task force declared under the chair of by vice chairman of the UGC, and the task force decided to focus on Pithania ashwagandha as a prophylactic and the 3 adjuvant as a add-on effect, adjuvant as glycyrrhiza glabra and pippali and 1 polyherbal formulation. And you can see the whatever is the CTRI registered, 88 clinical trials are registered, and those are the clinical studies, and some of trials prophylactic are in the public health research. Some are the observational studies, and some of the retrospective database analysis, and now it is post-COVID management protocol also. Some of these, you can see the majority of the trials, even in India, all the clinical trial registered with the conventional medicine and the traditional medicine, more than 61% trials are from the Ayush system, and that's how the scientific rigor in managing the COVID. That's what the ministry has, ministry's initiative, and its integration with the conventional medical partners like AIMS, then the basic sciences like DBT, DST, ICMR, CSIR, and it's not the understanding the molecular mechanism, also the clinical practices. And it's not only the partnership within India, but the outside India, like with USA, Boston, Spalding Rehab, Harvard Medical School, with Israel, with South Africa, Brazil, UK, Federal University of Sao Paulo, UK, and Ghana. And we look forward to have meaningful collaboration with the Argentina and more clinical studies and partnership with the Brazil also. And if we look at the glimpses of interim trends of the studies and stand alone, and we can see that the 88 clinical and preclinical studies, 72 clinical and 7 preclinical, 6 retrospective, and those are at 112 sites, and the and more impact assessment of the advisor is 1.4 crore people, and out of that 87% said that they are using the advisories, all the immunomodulators mentioned in advisories. These are some of the what we can say immunomodulatory potential, and you can see out of Delhi, the earlier what we said, that other Delhi same cohort from Delhi population, and you can see the mortality which is really reduced, and that's the impact of the immunomodulators. And even there is a peak second wave, the cloud of the population there also with the advisories, the Delhi police even post treatment also for 1 month they are safe, and the impact is really very good. And the same is with the CHC, because 24/7 all healthcare workers, they stay with the patient, but they are still safe, and they are not they have not got infected till now. It's our 15th rotation. More than 3 months have already passed, but all of them, they are safe. And you can see 330, there is an incidence of COVID infection is 0. And that's the strength of Ayush, where each and everyone follows yoga, each and everyone does the meditation, they take the herbal decoction, Sanshamanivati, and many modulators. And you can see the impact of Ayurveda intervention in prevention COVID in identified containment areas. It is not only the hospital, but where there are red zones like containment, more numbers are there, where then Ayurveda intervention, Ayush intervention was added, then the number of cases significantly reduced as compared to the zone where the intervention was not included. And you can see that after adding in the control group, it is 58%, and in the study group, rate has been reduced considerably. And that's how the impact is in the containment zone. And each and every study, whatever is done, that is supported with the robust statistical analysis, data management system, and each and every one is being a manuscript. It is in the publication state, so that it would be published in a high impact journal. So these are many of the studies. This study I would definitely like to mention here. It is not only in Ayush hospital or containment zone or in the public health, but the conventional allopathy tertiary care hospitals like corporate hospital, Medanta hospital, when the Ayurveda like Ayush intervention like Kuduchi and Sanshamanivati Pippali was added, and you can see with the HCQ standard of control, this was given, and when this was added, number has come significantly down. It was 7.3, now it is 5.4. So the add-on effect has really helped a lot. So the Guduchi daily herbal health promoter has really helped in bringing down the infection to a significantly low level. And it is not with Ayush, but also the Arsenicum album as a homeopathy addition, that also has really significant effect. And also with the Unani and the Siddha also had the similar impact. So overall Ayush system, which is an experiential and evidence, has created evidence. And more important, it is not evidence-based practices like a drug development. This COVID has given us the opportunity to create a practice-based evidence. It's very important because it's a reverse pharmacology where the practices we have to really showcase the strength, and then we can understand the molecular mechanism at the molecular docking and the genome of the virus, and where the protein spike, where is the binding, that we really also have assessed where is the molecular interaction with the Ayurvedic successful herbs, and that is also being studied with the help of DBT, DST, and CSIR. And those are some of the not only clinical, but you can see we have the preclinical also study with the cytotoxicity and anti-diabetic and the antiviral, and many studies have already been conducted by our research councils, all the councils like CCRA, CCRUM, like Unani Siddha and Homeopathy. And I'm sure that Arsenicum, you can see this Arsenicum album also has really mass prophylaxis program in all the states in India. They have really used because it's very easy, safe, and you can see the 99% of the people, they really have reported to have the benefit effect. And you can see the evaluation of treatment with the adjuvant homeopathy in Gujarat state. And you can see the very, very encouraging result. 65% of the population had duration of hospital stay between 0 to 8 days, and 80% of the patients were, but that 66% had a relief of the symptoms. So this is something which is encouraging. From each and every system, we have picked one which is a very potent, like from Ayurveda, it is a Guduchi, Ashwagandha, and from Homeopathy, it is a Arsenicum. Unani, there is a Siddha, it is a Kabasura Kodinir, which is the polyherbal formulation, and which also has really come out with the significant improvement. And so overall impression from this interim trend can say that it's really helped in lowering significant incidence of COVID-19 among the intervention group, the onset of, and it is not only the COVID-19, because it's so overall general antiviral effect. And I and myself and all of us, we have observed that the seasonal change, there is a flu season, there all overall flu-like illnesses have also been reduced significantly. That's the achievement we can say. And what is one more achievement is that so far Ayush systems were being used only for the non-communicable diseases. This COVID pandemic has given the opportunity to Ayush system to showcase that the Ayush is equally effective in communicable diseases. And we can showcase within 7 days, 9 days, that RT-PCR positive become negative. Immunomarkers, even D-dimers like coagulation profile, that significantly comes down. Immunomarkers and interleukins, we can show the result and as comparable as the conventional medicine, because now there is no system which is above and which is low. Everyone is equal, and we should really have not competitive strength but complementary role where we can really help the humanity in this unprecedented time. And you can see the country-to-country MOUs, Ministry of Ayush, international cooperation is really working and looking forward for having more meaningful partners which really can take this message and to create an evidence to this age-old system so that it can be recognized and it can be used more effectively, not only as a preventive but as a treatment to the countries as like the drug which are being used. And that's how the Ayush representation in multilateral international forums, and Ayush is representing not only as only mission or cell, but with the WHO, WIPO, IRCH, WTO, IPSA, SARC, Asian and now EU countries and the BRICS. So we are the partner and we are promoting this system as an evidence-based medical care. Thank you very much for patient listening, and it was really great opportunity and honor to share the strength of Ayush, what we could do in this COVID pandemic. And I'm sure you in Brazil, Argentina, and all the viewers will take the message to use this not only as a prevention, as a management, but also as a post-COVID rehabilitation and restorative management. Namaskar. Thank you.
Thank you, Dr. Tanusha. Thank you a lot.
Thank you.
Yeah, Dr. Tanusha, thanks a lot. Thanks for sharing this information. As always, it is said that in India, any number is big numbers. When you have mentioned 1.4 crore, I want to mention that to all the people that it is referred to 10,400,000 people. And we are very, very happy that you have the opportunity to present all the work at the Ayush sector and also at the Institute of Ayurveda. We know that right now there is no cure for COVID-19, but you have presented very, very interesting and promising results that we hope that we could share and replicate here in our continent, Latin American continent. I want to share also that, as I mentioned, of the 52 medicinal plants presented in the ebook, 40 medicine plants are right now in Argentina and also in Brazil. And this document, it will be presented, it will be available and presented to all the health ministries in our nations, to the medical associations, professional associations, and also to the groups related with the Ayurveda. For all the people that could have this document, it will be available at the website of TCM, Medicina Tradicional, la Biblioteca Virtual de Salud de Medicina Tradicional Complementaria e Integrativa, and also at CAPSIN website and Ayurveda Prema website. Dr. Tanuja, really thanks for your presentation. It has been very enlightening and show the path forward that we must follow. Thanks a lot and regards. Namaste for you. We know that you have been taking a lot of pain to be here with us in this very important day in India because it's New Year. Thanks for your cooperation.
It was a pleasure. Thank you. And we congratulate for ebook also. Thank you.
Thank you.
Dr. Tanuja, can I?
Sure, sir. Sure, please.
I really wanted to thank you. It was a very interesting and fascinating presentation. And
thank you, sir.
Request for a copy of the presentation because we would like to translate it and also circulate it to all our friends in Brazil and of course also in Argentina and other parts of Latin America.
Sure, sir. Sure. And to yesterday also we have released one film on the Ayush initiatives on the video, so that also we would share. Sure.
Because we would also like to share it with the media here so that we can create awareness about the success of Ayurvedic practices in treating pandemic and strengthening immunity in the body. Thank you.
Thank you.
I want to convey also regards from Sri Dinesh Bhatia, Indian ambassador in Argentina. He had other meeting and express gratitude and all the best for you during this presentation.
Thank you. Thank you. I'm blessed and honored. Thank you.
Thank you. Namaskar. Even I will now urge to continue your discussions. So thank you.
Thank you. Thank you.
Natalia.
Thank you. So now we want to do a little change in the academic program of today. So now we welcome to Dr. Manchanda, who is right now the Director General of Central Council for Research in Homeopathy of the Ministry of AYUSH. He is a physician of the Faculty of Homeopathy of the UK. He has a PhD of the Siber Java University College of Medical Science of Malaysia. He has also an MBA in healthcare, and he has a master's degree in homeopathy. So Dr. Manchanda will talk about the experience of the homeopathic response in all the COVID-19 pandemic. Dr. Manchanda, it's a pleasure.
Thank you.
Welcome.
No, thank you, Natalia. First of all, I would just like to inform the audience that I was former Director General about 1 year back. I have now joined Government of Delhi, and now I am Director of Ayush. I look after homeopathy, that is my specialty, but I also take care of Ayurvedic and other institutions at the level of Government of Delhi. So thank you, Natalia. I'll be now sharing my screen. First of all, thank you to the organization that you have given me this opportunity to share experiences of homeopathy. And in this, as you know, India believes in medical pluralism, and homeopathy is also one of the modality recognized by the Indian government. And Ministry of Ayush looks after homeopathy as well. I will now be sharing with you what is going on in homeopathy as far as Ayush COVID-19 pandemic is concerned. So I'll be talking for about next 15 to 20 minutes on these 4 topics about the homeopathy in epidemic, what are the opportunities, what are international initiatives are there, and what initiatives Indian government and Delhi government has taken. So as we know, epidemic have been closely associated with historical evolution of homeopathy. Epidemics of Spanish flu, yellow fever, scarlet fever, diphtheria, typhoid were managed well with homeopathy during pre-antibiotic, pre-vaccination era. But with the evolved understanding of modern microbiology and preventive medicine and introduction of vaccine, the incidence of certain diseases have gone substantially reduced. The benefit of homeopathy in the past are also being questioned by certain critics. Now, with the emergence of new strains of microbes, such as MERS, swine flu, Ebola, dengue, and now COVID-19, where vaccines are not yet available, the global concern, and these are posing great challenge to the existing knowledge. Now, as homeopathy has a track record of safety, easy integration with public health initiatives, can be given even to pregnant women, babies, elderly people. Production, storage, and distribution of medicinal product is simple, cost-effective, and scalable in short time. So these points of homeopathy gives a unique opportunity for its mass usage during pandemic. Normally, homeopathy has two approaches. One is the approach of genus epidemicus, when a drug which is found to be curative in majority of the cases of epidemic is also the most likely preventive for that disease. And the another is use of sarcodes, biological material, prepared from medicine prepared from biological material using homeopathic pharmacopoeia techniques. So we all know that during 1918, when there was a pandemic of Spanish flu, it is reported in homeopathic literature and medical journals that people, those who got homeopathic treatment along with conventional treatment, had less mortality. At that point of time, few drugs like Gelsemium, Bryonia, Eupatorium perf, these were considered as the genus epidemicus. And you can imagine when there was no knowledge of even viruses, homeopathic community at that doctors developed a nosode that is now known as influenzinum from the swab of the patient and from the discharges. So that was the innovation that was being done by the homeopathic doctors even during Spanish flu pandemic. And even subsequently during swine flu in Delhi government, we collected data of considerable number of patients, more than 1,000 patients, and we shortlisted drugs like arsenic album, bryonia, belladonna during swine flu pandemic in India. And there are n number of publications, like this is that one randomized control trial where in cases of influenza-like illnesses, homeopathic medicines like arsenic album and many other drugs were found quite effective. So, but now in modern times, there are great challenges to validate these age-old systems. Like for genus epidemicus technique, it is a very stepwise process where we first need to collect data of the disease, patients, then identify some group of medicine, use those group of medicines on actual patients and see how patients are responding to that, and based on that, and then experience of homeopathic doctors, we have to shortlist a drug or a group of drugs. This is what is known as genus epidemicus. And during pandemic, there are more challenges because then we need to network across the nations. More importantly, in modern times, what is needed is when we shortlist any genus epidemicus, that needs to be further validated through randomized control trials for prevention as well as for the treatment. But before going for randomized control trial for a new disease like COVID, we need to consider what are our basic observational. So we first need to take retrospective studies, cohort studies, observational studies, and gradually move toward the randomized control trial studies. In respect to specific nosodes, there are certain guidelines even by WHO, where we need to follow modern standardization techniques as well as safety and efficacy techniques that include use of modern technology, use of animal models for the testing, as is being done by more or less like for the vaccine development. So these are the points that we need to consider, and we need to provide that kind of resources for the development of specific nosode for COVID-19. As we know that homeopathy is practiced in about 100 countries, there are about 600,000 prescribers. Brazil, Argentina, I know, are well-known countries. They have a tradition of very, very long tradition of homeopathy of more than 150 years, like India, and many of the Latin American countries have this tradition, and many universities are teaching homeopathy there. At present, even our president of Liga Medicorum Homeopathic International is an Argentinian medical doctor, Dr. Gustavo. So homeopathy has a good presence as far as the Latin American countries are concerned. But when we look at COVID, where there is already 48 million patients are there and they are spread all over the world, how this homeopathic community is responding. So when the few cases were recorded in Hong Kong and China, this first paper came and they shortlisted 3 drugs, Bryonia and Gelsemium and arsenic album, and they used in these patients, and this was later on published as a case series. As I told you that there is a international organization, LMHI, that has presence in about 80 countries. President is presently an Argentinian doctor. What we have taken a global initiative where we are requesting all homeopathic communities and institutions to collect cases and share centrally with the expert group. And we have been able to shortlist 5 drugs, arsenic album, Bryonia, Gelsemium, phosphorus, and pulsatilla. These drugs can be used depending upon the symptoms of the patient for the treatment of the patient as an add-on to the conventional or standard treatment. And for mild cases, even these drugs are sufficient for the treatment. Now, as we know, in India, homeopathy is recognized along with Ayush systems, and we have a strategic advantage of human resource, where there are about 300,000 homeopathic doctors are there. There are about 250, about 235 homeopathic medical colleges are there. There is a proper legislation to control the homeopathic clinical practice, homeopathic education. We have a specific organization, Central Council for Research in Homeopathy, where I was Director General when I met Natalia few years back. And so there is a complete institutional mechanism of homeopathy. Homeopathy has been integrated into public health system. So this gives a very, very strategic advantage to India as far as homeopathy is concerned. So when number of COVID cases started rising, and Ministry of Ayush took a very unique policy decision of integrating Ayush systems into the COVID care. Ayush manpower, Ayush modalities, based on the evidence available, those were immediately integrated for preventive, prophylactic, for the management of mild to moderate cases, as well as even for the severe cases. Institutions were issued guidelines that if they wish, they can develop evidence-based studies even for the serious patients, where Ayush modalities can be integrated and subsequently evaluated. So based on that, Ministry issued guidelines for even homeopathic practitioners for COVID-19, where they issued specific guidelines, what general precautions are required to be followed, and how to manage mild as well as moderate and severe cases, and what kind of group of medicine can be considered. But one of the restrictions was that all these modalities are required to be used by qualified homeopathic doctors. All these managements are required to be done by that, not by anybody. So just based on this policy, now since I am working in Delhi, we converted all our Ayush dispensaries as well as Ayush institutions, all public health institutions, and we told them that now we are required to treat COVID patients in these patients. whatever enabling infrastructures were required to be strengthened, that was strengthened so that these institutions can handle COVID patients. Based on the advisory of the Government of Delhi, Government of India, a specific advisory of self-care that included Ayurvedic modalities, homeopathic modality, Unani modalities, self-care modalities like taking always drink adequate lukewarm water, daily practice of yoga, pranayama, meditation, regular use of certain spices like haldi, jeera, dhania, and lesson in cooking. All these advisory was given and it was widely circulated to all the Delhiites through all social medias and print medias in all different languages. Our institutions were converted into dedicated COVID healthcare centers, and patients were given homeopathic medicine at Nehru Homeopathic Medical College, New Delhi. So far, about 500 patients have been treated in this center. Even conventional allopathic hospitals, where we have already homeopathic units, they were strengthened. And doctors were encouraged to use homeopathic drugs alongside the standard treatment that is being given. All these experiences are being documented. All Ayush personals of Delhi were given specific training of COVID care. In India, we have about 80% of healthcare is in private sector. So all private sector Ayush doctors, they normally constitute about 40% of the workforce of India. So they all were given training, online trainings to handle COVID patients, how they can handle even at their private clinics. And all public sector doctors were not only given training, but were posted in COVID testing center, COVID care center, and COVID health center for the actual management screening of the suspected patients alongside the allopathic doctors. Homeopathic, as Dr. Tanuja Nesri has just informed, that in containment zone, even for the prisons, in old age homes, in child care homes, homeopathic medicines were given as immunity boosters. Arsenic album was suggested by Central Council for Research in Homeopathy, and that was given, and thousands of these doses have been given, and data is being maintained. So data of all these initiatives are being maintained, and all kinds of research, whether it is adjuvant homeopathic treatment research or retrospective analysis of these patients, all is being done. And this is the first paper that has been recently accepted. This profiles the clinical characteristics and remedy profile of patients, those who were of COVID-19 that were treated at Nehru Homeopathic Medical College. This paper gives an idea of what kind of homeopathic medicine and what are those symptoms profiles that can be used for more rigorous clinical trials. So this one paper is going to be released, I think, in another week time. And this another study is that COVID remedies in homeopathic remedies in COVID-19. This is the prognostic factor research. This study has been done in peripheral dispensaries, where about 327 COVID cases were very well documented. And now homeopathic medicine and their precise indications have been shortlisted in this paper using prognostic factor research model. And based on that, now we are planning to undertake further treatment trials with randomized control rigor. These 4 drugs have been shortlisted in our second trial: arsenic album, bryonia, gelsemium, and pulsatilla, with these specific indications. In addition to that, groups headed by Dr. Rajesh Shah and even Central Council for Research in Homeopathy are trying to develop COVID-19 nosode. This is a this can be a very path-breaking initiative. Already initial studies, safety studies have been completed partly, and animal studies are going on. Further phase 1 studies, observational studies, and these are being going on. And Government of India has shortlisted this project, and CCRH and his team is working with Dr. Rajesh Shah to see to what extent these different variants of COVID-19 nosode can be effective, and can they really substitute vaccination in the long run? If so, it is a very unique initiative. So we need to appreciate, and probably Dr. Rajesh Shah shall be presenting this on 25th and 26th about the more detailed version of the outcome of these preliminary studies. So friends, in India, as I told you, that there are many homeopathic institutions. Even at CTRI, there are about 30 clinical trials have been registered. And out of that, one is registered by even Government of Delhi, where we are doing randomized double-blind placebo-controlled trial of 3 drugs, arsenic album, bryonia, and camphora, in about 20,000 population of Delhi during this time when there is a very cluster randomized trial. So we have registered this, and this recruitment to this trial is still going on. So friends, it is a unique opportunity. More and more ideas are being generated by Indian scientists. Like one of the idea that was published was that isopathic remedy prepared from the convalescent plasma. This is one of the kind of a sarcode that can be used to trigger immune response in patients. Then for the use of repurposed homeopathic drugs, as I discussed with you, some of the drugs, these are the repurposed homeopathic drugs. Then another drug, one idea has come for the Merksol in one of the southern states of India. This has been published. And there is a full issue that has been published by Indian Journal of Research in Homeopathy, which is a open access journal. All of you can go through, and I think we have even Spanish abstracts in this journal. So it is free of cost. All of you can go through. It's a COVID special issue. People, those who are interested in homeopathy, must go through this. So many ideas have been discussed, and future plans have been discussed in this issue. So just to conclude, COVID-19 is a new disease. There are currently no homeopathic preventive and curative medicine of proven effectiveness. Homeopathy has the strength of being useful in preventing and managing the epidemic based on specific symptoms in the past. But high quality clinical as well as basic research should be undertaken to validate the existing and to create new knowledge in homeopathy for COVID-19. So friends, these were just my thoughts as far as homeopathic concepts are there for COVID-19. And I think it is a very unique opportunity for all of us to work together, to find out how Ayush as a system can help in containing, in preventing, in managing COVID-19, because these are very, very cost-effective systems. And in India, I am seeing every other day that patients, thousands and thousands of patients are using this in their daily life and are being benefited. And I hope now the world across, people are having faith on Ayush system. They will look into this more closely and will use in their daily routine. So thank you very much to the organizers for giving me this opportunity. Thank you.
Thank you, Dr. Manchanda. We really appreciate that you accept the invitation to participate in this webinar and to join us. And we also appreciate all the wonderful information that you bring us today. And Ricardo Gallman is telling us that they are working with the academic consortium and with the Professor Carla Hollandino to bring to Brazil the homeopathic protocol for COVID. So for sure they will be talking with you in the next days. about that. So thank you a lot. Thank you,
Thank you.
and we appreciate your time also.
Thank you.
So now, Dr. Berra.
Hello. Thank you, Dr. Manchanda. Thanks a lot for your presentation. And right now, for me, it's a pleasure to introduce you, Dr. Gita Krishnan. Dr. Gita Krishnan is the representative, just wait a minute, I want to, Dr. Gita Krishnan is working with the World Health Organization at Geneva. As a part of the Integrated Health Service Department, he is responsible for the WHO's inclusion of AYUSH system in the global healthcare and for the appropriate use of these medical systems by WHO's member states. And I know he has been working very, very hard and with great enthusiasm and collaboration in order to produce very important documents related to the Ayurveda, guidelines about Ayurveda and Panchakarma, and also other Ayush medical systems. He is really one of the most important and prominent medical doctors in the Ayurvedic world, and it's a real pleasure that he will be introducing, sharing with us which is the situation of Ayurveda globally at this moment. Dr. Gita Krishnan, thanks a lot to be with us here at this moment.
Thank you.
Happy Diwali to you.
Happy Diwali to you.
Yeah.
Thank you, Dr. Berra, for inviting me to this, first of all, and then giving me this opportunity to speak in this forum, in this wonderful forum, where you have come together to create a platform for traditional medicine. And you, as a personal endeavor, has been constantly running and moving forward the agenda for Ayurveda in the continents which covers like America. So I'm so happy that I am here, and it is also a very auspicious day for me. Of course, for all of us, it is Deepavali, and it's a really good day to have chosen this particular meeting. I would also, with your permission, I would get into my presentation. I would like to acknowledge the presence of Ambassador Sri Suresh Reddy from Brazil, and Ambassador Sri Dinesh Batra from Argentina. Dinesh Bhatia from Argentina among the group of people who are present here. I would also like to acknowledge that Dr. Tanuja Nasari and Dr. Rajkumar Manchanda are here, and my friend Dr. Ramanohar is also here, and Dr. Prasad Vinjamuri is also here, and all the respected members of this council of people who are discussing here. I would like to share my presentation, yes. So this was the topic which was given to me by Dr. Berra to provide a panorama of the Ayurvedic situation across the globe right now. And I am presenting my perspectives on here. It's because it is so wide and so expansive that I might not be able to do justice if I say I have presented everything, but I have presented few. I am going to present few details of what is available as the global scenario of Ayurveda. I would like to start with what did WHO and WHO looks at it, or how WHO looks at it. WHO and traditional medicine, which of course the Ayurveda is a part of, has a very interesting way of relationship, because WHO in its earlier period before 1965 or so did not consider traditional medicine as an ally, but was possibly looking at it from the point of view of safety, and was considering it as a threat to the public health delivery system, where traditional medicine practitioners, which WHO's perspectives could not understand, was delivering medicine simultaneously with the believed to be perfect medicine which was being provided by the conventional medical system. So there was some kind of a misunderstanding in the earlier period, but from 1970s onwards, WHO had taken serious interest in traditional medicine. and then had started considering traditional medicine as a possible ally. In 1978 was the first time when WHO officially announced its Alma Ata declaration on PHC, and it was during this declaration that WHO recognized traditional health practitioner as a resource in primary health care. It was about 2 years before, and a year after that, means just 1 year before, the WHA, the World Health Assembly resolutions, had been very supportive to traditional medicine inclusion in public health care delivery of related to different countries. After 40 years in 2018, Astana Declaration, after 40 years of Alma Ata Declaration, the Astana Declaration also approved or reiterated what Alma Ata Declaration had said, and at the same time gave out new dimensions wherein which Ayurveda traditional medical systems could be included in the management of public health care delivery. WHO looks at traditional medicine from 3 pillars, or point of view of 3 pillars. But they are the products, the practitioner, and the practice. And we have been very much invested in developing norms and standards for products, practices, and practitioners. Like I could give you some example through by taking the example of Ayurveda itself. In Ayurveda, WHO is at present developing international norms and standards, which we call as benchmarks, for training and practice in Ayurveda. We are also developing an international standard terminology for Ayurveda, so that the communication between the Ayurvedic practitioners and Ayurvedic trainees and people who are trying to understand Ayurveda becomes uniform and consensual across the globe. We are also developing morbidity code for Ayurveda for inclusion in the International Classification of Diseases, version 11, as a module within the traditional medicine chapter of ICD-11. So this probably will be a great step for Ayurvedic community and Ayurvedic science and evidence creation for Ayurveda and data creation for Ayurveda. Because even though there are millions of clinical interactions that are happening across the globe in Ayurvedic area, in the area of healthcare and health management and preventive medicine, there aren't enough data available in our hands, because there isn't any appropriately codified, universally understandable data like collection tool available. And ICD-11, this Ayurveda chapter, is supposed to create that tool, and I hope that once that is done in the next few years, we might generate considerable amount of data for creating evidence base for Ayurveda. We are also established intra-governmental agencies for developing consensus in regulatory framework for herbal medicine. This is the International Regulatory Cooperation for Herbal Medicine. This is a conglomerate of 33 countries and a few observers in it, in addition to that. So this 33 country, what happens is WHO under its aegis, we call together the pharmaceutical heads of or policy makers or drug regulators of these countries together, and we try to create a common framework for traditional medicine or herbal medicine medicine regulations, which in the long run is supposed to have a very seamlessly integrated kind of a regulatory format, which will allow transnational uses of medicinal products, and make it more available and accessible, and make it as accessible as probably the modern medical like molecules or entities are available across different countries. We are also developing an international pharmacopoeia for herbal medicine. You know that pharmacopoeia are the basis on which the governments approve or regulate any medicinal product. So when with the development and the launch of this pharmacopoeia, it is expected that the member states who accept this pharmacopoeia will have greater ease in accepting traditional medicine products, especially herbal pharmaceutical products from different countries who are following the kind of standards and regulations which the pharmacopoeia recommends. There are several products of WHO related to traditional medicine. These are few of them. I would suggest if anybody who is interested to go to the WHO website, go for traditional medicine, type and search for traditional medicine and go for publications. You can get all these publications as downloadable documents and PDFs in the WHO website. Some of them are very useful, so probably if anybody is interested, could try these. Today, is just one day after the announcement by the WHO DG, Dr. Tedros, when he announced during the Ayurveda Day program, which was organized by the Ministry of Ayush, where he shared the dais with the Honorable Prime Minister of India, Sri Narendra Modi, where he announced that the WHO's Global Center for Traditional Medicine is going to be established in India. And in reply to that, or after that announcement, the Prime Minister of India said that it is going to be a great responsibility which the Indian government and the people of India will have to take up, and will do everything and everything that is necessary for appropriate research in traditional medicine across the globe, as well as for giving directions for forward movement of integration of traditional medicine appropriately in different nations. So this was something which happened just yesterday, and this was a very happy moment for all of us, especially those who are interested in traditional medicine and its progress. During the COVID-19, traditional medicine has been considerably looked upon by WHO with some interest. I can tell you that on 4th of May, Dr. Tedros, our DG, expressed his views that all medicines are the same and to be looked at in the same manner if it is being explored for a new disease. And he said that the main criteria of defining a medicine which as useful or not useful to be included or not included is its efficacy and safety. This was on 4th of May during his daily address to the globe or related to COVID-19 matters. On the same day, Dr. Moiety, the regional director of WHO Afro region, made a similar statement saying that the African regional office will be supporting the African nations to come together to create and develop and research on herbal medicines for COVID-19 management. Following this, the African regional office conducted several international, in fact, within Africa, international joint meetings where internationally acclaimed people were called together, and a common protocol for development of herbal medicines for COVID-19 and its research has been developed, and it was published in late July. There has been several other countries who had been working in traditional medicine during the COVID-19 period. Like China is an exceptionally notable example where several studies have been conducted from the very beginning of the disease, and we have in hand like many clinical publications as on today. Similarly, in the Southeast Asian region, the country of Sri Lanka had been quite actively utilizing the Ayurvedic resources in the prevention and management of prevention of COVID-19 spread and management of early symptoms of COVID-19, because they have a very excellent, really excellent health system model where there is a community medicine Ayurvedic group. It is a Ayurveda community health program there, which is though called Ayurveda Community Health Program. It is manned by Ayurvedic doctors primarily, but also by Siddha doctors as well as Unani doctors. These grassroots level primary healthcare Ayurvedic practitioners had been quite effective in preventing the spread of COVID-19 by intervening at the right point and the right time within the entire community of the island of Sri Lanka. So that was an excellent thing which had happened in Sri Lanka. At the same time, India was full of activities related to Ayush, and you had just seen what when Dr. Tanuja Nesari made the presentation for the Secretary Ayush. You had seen the entire spectrum of activities which had happened in India during COVID-19. And of course, Dr. Ram Manohar, who is going to speak after me, will be giving you more details of the research aspects of that. So I'm not going to dwell into that. But I can tell you that India very effectively utilized Ayush systems for reducing the burden of the disease on the health system. That was an excellent model. I think I wonder why it had to wait for such a pandemic to happen. It should have happened much earlier. This pandemic, this disease, it can infect you very fast, and it can spread very fast. Even though the mortality rates are much lower than many of the related coronavirus infections, we know that since the number of people going up, and even a small percentage of that people, that huge number becoming critically ill and needing critical care, would end up in a system crash within the health system. So what Ayush system has done in India is phenomenal in the manner that it reduced the burden on the health system by intervening at the right time and reducing the number of people reaching the stage of or needing the stage of critical care management. And that was a tremendous like support which was given by the Ministry of Ayush to the health system run by the Ministry of Health. So this is something I think will be studied in future, how it has happened and how effective it had been, etc. But WHO, along with the Ministry of Ayush and the Public Health Foundation of India, is doing a study at this particular moment to understand the facilitators and barriers of Ayush interventions during COVID-19, just to understand how in few places in the country it has been very effective, how in few places in the country it was not even launched, how in some places it had been very, very effective as a community-based medicine, how in some places it had been very effective as a hospital-based medicine. So we are trying to understand this difference, because India is a large country, but we are larger in terms of our number of people. We are the second largest population in the world, and we have a huge number of infrastructure. We have a huge infrastructural deficit in terms of managing these things. So how we manage this using Ayush in the most appropriate manner is something of a study which needs to be taken up very seriously soon. This will be explained by Dr. Ram Manohar, so I am skipping this information. Ayurveda in across the globe, Ayurveda is present in today's date in 93 countries. This is based on a study which was done by a global survey which was done by the WHO and published in 2019. It extends from New Zealand to Canada in its spectrum, and it is available in many countries in different formats, different types of practice, different types of regulations, different kinds of training programs, different areas wherein which it is being covered through insurance, different methodologies of insurance coverage, etc., etc. So it is quite interesting to see that, because I'm fortunate to be at a place and in a location where I can get this information and understand this information from a larger perspective. So like Ayurveda is core and available in India, Nepal, Bangladesh, and Bhutan and Sri Lanka. It is available and there. It is an extensively approved regulated practice in Malaysia. It is a regulated educational program in Australia, as well as in Switzerland. It is also available as educational programs in Canada, USA, Brazil, and Argentina. Especially in Argentina, you have this special program where Ayurveda is being taught in a very systematic manner for modern medical practitioners. And it is. I'm very happy to say that it is run and has been going on for several years now under the leadership of Dr. George Berra. So with this, I would like to tell you, like, give you a broader picture in comparison with other traditional medical systems across the globe. If you look at this, you will understand that Ayurveda, which is this light blue colored bar on the second from the right, we have 93 countries who somehow or some way or other accepts it, in comparison to other medical systems. Like, let us say, if you take traditional Chinese medicine, it is available in 100 countries. Homeopathy is available in 100 countries. Chiropractic is available in 96 countries, and Unani is available in something around 82 countries. So there is a tremendous increase in the number of countries accepting traditional systems of medicine, and simultaneously few of the systems have started getting greater highlight or limelight and being accepted more and more. You all can also see that there are 16 countries in the world where Ayurveda is regulated as a practice in one way or other. That means if you have a certified or approved training program, if you have gone through a training program, depending upon different pre-qualifications. When I say pre-qualifications, I mean that somebody who is totally unqualified as a doctor can train themselves in Ayurveda and start practicing Ayurveda, or somebody who has been already trained as a pre-qualified as a doctor or a physician can train themselves further in Ayurveda and practice Ayurveda. So in this manner, there are 16 countries where Ayurveda is regulated, and there are 5 countries where Ayurveda is covered through insurance programs. Next question is whether like when we talk about the spread of Ayurveda, one of the main things which we usually talk about is the evidence and the barrier it creates, or rather the lack of evidence and the barrier it creates. But basically, this is not an information, but this is a question to put into all of your mind, which I would like to inject you with this question: whether is it evidence that really keeps the traditional medicines away? We really need to think about this, because if you ask about the story of Ayurveda, I would say that the story of Ayurveda has only two chapters as on today. One is before COVID, one is after COVID. Like before COVID, we knew that Ayurveda was basically more of wellness or more of degenerative disorders management, or chronic diseases management, NCD management, or general health care, etc. Whereas and we had nothing to do with infectious disease management, even though there has been studies and there has been effective case series publications on dengue fever management or chikungunya management. It was never seen seriously. After COVID, there is a big change in the perception of the community and across the globe. As you could see from the data which was given by Dr. Tanuja Nesari, that there is a definite perception that Ayurveda is useful in wellness, but very specifically in immunity care, in improving the immunity, very specifically. Now you have something of a very specific outcome to be given. There's a very specific clinical outcome in wellness which you have identified. Then comes, for all of a sudden, there is a big demand for viral diseases management from Ayurveda. You can see that it is already there in terms of COVID. Now it is spreading into other situations also, where there are already questions being asked about other viral diseases, other chronic viral diseases, like a hepatitis C infection or a hepatitis B infection, which were all there and which we all had some kind of an evidence available, but never followed through, because it was considered to be something of a taboo to talk that traditional medicine will treat infectious diseases, and that too viral diseases. So there are 2 chapters now. One is before COVID and after COVID. It is for, I'm talking about Ayurveda, but it is generally for almost all traditional systems of medicine, including homeopathy. This is a great time for us. And we also have to understand that the barrier which was created as evidence, science-based evidence, was actually never there. It never happened in the time of COVID, because COVID, when the traditional systems of medicine was kept aside, at least we know that they were safe kind of a drugs were kept aside, possibly effective kind of a medicines were kept aside, and based on science or based on whatever you consider as possible science, based on chemical evidences, based on computer generated imagery of a proteins, protein molecule docking onto the surface of a cell. We had decided that there are 4 medicines which are the best effective medicine for COVID-19. We did the largest study available across all the countries, across several countries in the globe, which was called as a solidarity trial on 4 drugs. Like India was a part of it. I'm sure that many of us who are participating in here, our countries were also part of it. What was the result of the solidarity trial? On 15th of October, WHO published a document saying that all the four medicines in solidarity trial which underwent the study were ineffective or not effective at all, insignificantly effective in 28-day management of COVID-19 in a hospitalized patient. In fact, in simple words, it was ineffective. We are sorry, it didn't work. So who decided the division in this evidence? Who decided something as useful, something as useless, something has to be kept aside, something has to be kept inside? This is something which we need to think about. We are very clear that it is not evidence from science, it is not evidence from experience, it is not evidence from anything that any kind of ethical acceptance could be given to. It was basically the hegemony of the existing system that made sure that these group of medicines were given to millions of people as treatment or prevention for COVID-19, whereas possibly available safe medicines were kept aside. I don't have an answer for this. I don't have definitely not a possible answer for this, but I think this is a big question I want to leave you with, because this is very, very important. And this is how, if you don't go beyond the scientist controlling the socially relevant aspects of something to be implemented into the society, we are never going to go beyond what is being done right now to traditional medicine. We have to get the scientists to be having as an equal partner in a social project. You cannot get the scientists to run the program. Like if that had been the same, if anybody who creates an idea, creates a product, creates a program, has to run it also, then you can imagine that Michael Schumacher, who was one of the best F1 racer, would never have driven his car. It should have been the designer who designed the car who should have been running it. It is not. The ability to run something and the ability to bring something into the society and the ability to create something are two different things. People who create it, if they think that they can also implement it, it is totally absurd. It is not going to happen. So we have to have equal capability in the driver's seat in managing healthcare for the entire globe. Otherwise, we are going to face with this similar problem, which says that evidence, which is actually not evidence, is evidence, and the entire globe keeps believing it. And this is so important at this particular moment for the entire traditional medicine, specifically for traditional medicines like Ayurveda, Unani, Siddha, traditional Chinese medicine, homeopathy, etc., which have hundreds of years of existence and knowledge in their hand. This is all I have to say today. Thank you so much for giving me this opportunity.
Dear Dr. Gita, thanks a lot for your broad view about the situation, global situation of Ayurveda all over the world. You are a very good witness of this situation. And thanks a lot also for sharing your thoughts, your philosophical questions, because these questions must be answered and will be the focus of our work here in Latin America also. Thanks a lot. Thanks for your participation. Natalia, seguís vos.
Gracias. So now we welcome to Dr. Ram Manohar, who is the Director of Research in the Amrita School of Ayurveda. He received a BAMS degree from Gujarat University of Coimbatore in 1991, the degree of MD in Ayurvedic from Rajiv Gandhi University of Health Science in 2001. He has been contributing in the field of Ayurvedic research since the last 30 years, and he has a lot of publications, index research paper in the index journals and chapters in book. He was honored with a lot of recognitions about his job, and he's presently serving as research director of the Amrita Center of Advanced Research in Ayurveda, attached of the Amrita School of Ayurvedic, managed by the Amrita Vishwa Vidyapeetham. He is also participating in the academic activities at Southern California University of Health Science, which in partnership with Dr. Prasad, who will talk in before. And he also participates in the European Academy of Ayurveda in Germany and Ayurvedic Point in Italy, National University of Rosario in Argentina. So please welcome Dr. Ram Manohar.
Thank you very much.
I'm sorry.
It's a great.
Ram, I also want to add that you are the director of one of the three academic journals, which is indexed in PubMed, and this is a very important situation for Ayurveda. Thanks for that.
Thank you. So thank you very much for this invitation to share my views on, the research initiatives that are happening in India with relation to COVID-19. Of course, Tanuja Madam has given a very detailed overview of all the Ayush initiatives. So I would like to also look at it from the point of view of a researcher rather than, from that official perspective. So I would like to give a critical appraisal and some pointers to what we can learn, from the research initiatives that have happened in India from the point of view of Ayush and especially Ayurveda for responding to the COVID-19 pandemic. So I have a small slide presentation. I hope it is visible now. So I'm going to give a brief overview of the research in the field of Ayurveda related with COVID-19 pandemic. So, right from the beginning, even though in India we have a pluralistic healthcare system and the WHO has really promoted and welcomed innovations around the world for repurposing drugs and even traditional medicine as potential treatment for COVID-19. India presents a pluralistic healthcare system that allows coexistence but not facilitate cooperation between different medical systems. So there is a lot of conflict, especially regulations, which had to be overcome before Ayush could be streamlined, for research and even practice. So I have to say that very early in March, the Prime Minister took a very important step by interacting with the Ayush professionals and emphasized that Ayush systems should come forward to respond to the pandemic, but must be careful not to make random claims related to COVID-19. Dr. Geeta Krishnan mentioned, in fact, he asked this question as to whether evidence is a barrier for, the development and application of traditional medicine. And I would like to also talk in support of this viewpoint, because right from the beginning, we found this was one of the biggest challenges that Ayurveda has been facing. Even the Prime Minister said that the Ayush community should be very careful and that we should not make, unfounded claims, and that Ayurveda should be led by proper research initiatives. And this was very interesting, because on one hand, the PM really pushed the use of Ayush and Ayurveda for COVID-19. But on the other hand, he also cautioned that we must follow on the basis of good scientific research. So there was a big move from the Ministry of Ayush to push scientific studies, and there were openings for a lot of scientists, research institutions and individuals to submit individual proposals. I think this is unprecedented in the case of an infectious disease and an epidemic, that the Ministry of Ayush opened up funding and also brought out a regulation that allowed Ayush practitioners and Ayurveda and Ayush systems to conduct clinical trials related to COVID-19. And most importantly, because research needs to be done with quality and rigor, so a group of scientists, this was very, very interesting because a task force was constituted, even as there were efforts made to curb the claims related to COVID-19. So on the one hand, the ministry supported Ayush to come forward. On the other hand, regulations were also kept to prevent false claims from being made, so that the credibility of Ayush systems are not affected. So the order to stop, prevent publicity and advertisement of Ayush-related claims was a very important step that was taken on the one side. So why I want to say this, that right from the beginning, a research-based scientific approach was promoted by the Ministry of Ayush, for the response against COVID-19. So as a result, in less than 15 days, 2,000 research proposals came. Instead of claims, people started sending proposals to the Ministry of Ayush, and this was a very overwhelming response. In fact, at this point, I want to also ask a question which Geeta Krishnan mentioned. This is a very interesting paper by Trisha Greenhalgh from the University of Oxford, who brings to our attention this conflict between evidence and response to a pandemic. Because she asks this question, will COVID-19 be evidence-based medicine's nemesis? What is the approach that we have to take, when we have a pandemic like this, when there is an urgency actually to respond to the situation? We cannot wait for, the most rigorous research to be done and completed before we can actually respond to the situation. And I think this is the dilemma that the Ayush sector faced at the outset itself. On the one hand, we had to respond to the pandemic, to the people who are seeking care. And the other hand, we had to ensure that all what we put forth as protocols or interventions had to be backed up by, rigorous research. And this was not going to be possible. So this was the kind of tension that prevailed in the beginning of the Ayush response to COVID-19. And I must say that a lot of hurdles were faced. We could not respond to the pandemic because of this challenge of having to produce evidence first before we could actually respond. And I would like to highlight this point here also, that in the beginning, because in India, COVID-19 developed very slowly, there was not a big burden. So in the beginning, Ayush systems did not even get an opportunity to respond to the pandemic. It was mostly, the whole focus was on research and development. But as the COVID pandemic began to kind of escalate, and in certain cities like Mumbai, Chennai, Delhi, when there were overwhelming number of patients, actually Ayush practitioners had to work at the ground level, and they had to use their clinical skills and experience to respond to the patients who approached them. And I have been closely following up from a research perspective what these clinicians have been doing. I was also involved in preparing some case reports, and now we are involved in doing analysis of a lot of outcomes that have been reported at the point of care. And from that perspective, I want to say that we need a two-pronged strategy when a pandemic like this comes. On the one hand, we do have to plan for rigorous research studies, but on the other hand, systems of medicine like Ayurveda have a better potential and a better framework to actually respond immediately to the pandemic. The results that we have experienced by the interaction of clinicians, which is unfortunately not getting very much highlighted or not getting very properly documented, I think is going to be a big lesson in understanding how traditional systems of medicine can, immediately step forward and respond to the pandemic without really having to wait for rigorous, research work to happen, which definitely needs to happen, but it will take time. So a balance between these two approaches, one is a practice-based evidence generation approach and the other is an evidence-based practice approach. We need to strike a balance, especially in the context of a pandemic. So it is in this background that an R&D task force was constituted. It was not a task force to develop protocols and apply, but an R&D task force. And I think the plus point of this task force is it was a combination of scientists from modern medicine, modern science, and doctors from modern medicine and Ayurveda practitioners. So this ensured that there would be a balance of both science and Ayurveda coming in when the research is being planned. So a 17-member team under the chairmanship of Professor Bhushan Patwardhan, who incidentally has been listed as, as an eminent scientist coming under 1% of scientists in the world by Stanford University. So we had very eminent scientists, allopathic doctors, Ayurveda physicians working together to create a research strategy, for Ayush against COVID-19. So this committee worked on clinical practice guidelines, clinical research protocols, and even guidelines for preclinical research, because this to promote research at all levels. I think this was an unprecedented kind of initiative in the history of Ayush systems in India, where such a team, multidisciplinary team, came together and did very intensive brainstorming to look at all the possibilities that are available to push research in the field of Ayurveda. And it's also very commendable to see that this task force constituted a committee for screening of research outcomes prior to publication, so that the quality of publications can be enhanced. All the research studies, before they submitted as a publication, would be screened by a dedicated committee to ensure that only good outcomes are actually published. So these are all the efforts that were taken by the ministry, and a lot of this information is available on the dashboard that the Ministry of Ayush has set up. Now, I want to not go into too many details about this information which is already available, which anybody can check up. I want to deliberate on few approaches and some debates that we need to really open up if we are to learn some good lessons and define how we should move forward from this experience of the encounter with COVID-19 in India from the Ayush community. Now, if you look at the thought framework, I want to show that what is the potential for research on COVID-19, both from a scientific point of view and from an Ayurvedic point of view, and how can we strike a balance? Because I have to say that most of the research, today when an Ayush practitioner wants to offer something for for management of disease like this, he's confronted with the demand to produce evidence. And what is the evidence? In what form is it needed? This is the framework in which an Ayurveda practitioner or Ayush practitioner is forced to produce evidence. What is our medicine going to do? Is it a virucidal agent or an antiviral agent? At what level can it work? An air purifier. So this is quite rich if you look at it. The scope for developing products and interventions from Ayush from an interdisciplinary framework is also quite rich. But I want to point out that still has limitations. This is not the best thing that traditional medicine can offer. So air purifiers, surface cleansers, nasal and mouthwash, antiviral drugs. You can also look at immunomodulants for preventive, supportive, therapeutic interventions, symptomatic managements, because a lot of patients need symptomatic care. And then for patients with comorbidities, what special interventions can be done. So this is the kind of targeting that one keeps in mind when we want to develop medicines from the Ayush system. But this is following the traditional method of pharmacological development. And this is not fully in tune with the traditional philosophy of systems like Ayurveda and Ayush. This is what I want to point here. While this kind of interdisciplinary research definitely can be encouraged, it will be time consuming also for Ayush systems to start beginning to produce evidence proving in a very rigorous manner what is happening. I will also show later what is the evidence that we already have and how long it will take before we can reach here and have very clear idea about how Ayush systems work from this framework. On the other hand, I think the real strength of Ayush systems is the whole system protocol, because COVID-19 we know is presenting in very strange ways. Different individuals are manifesting the disease in very different ways. The progression of the disease is also different in different individuals. And this is where I think traditional systems of medicine have a strength. I mean, the COVID-19 disease itself demands a personalized approach, something which is very central of the philosophical approach of traditional systems like Ayurveda and Ayush. And the fact that we are still not working in that direction in a very rigorous manner, I think is one of the shortcomings. But the Ayush task force also developed a whole systems clinical protocol. On the one hand, few herbs and few medicines were shortlisted. Tanuja madam was also mentioning about it. Ashwagandha, Guduchi, Tinospora cordifolia, then Amalaki, Umbilica officinalis, Yashtimadu, Glycyrrhiza glabra, and then Ayush 64. So some key formulations were shortlisted, and they are also shortlisted on the basis of rigorous background check, what is the evidence already available, and that is why they were shortlisted for the initial clinical trials. But Ayurveda and Ayush systems have much more richer pharmacopoeia and interventions also to offer, which we may miss if we just follow this biomedical framework alone to understand the pandemic. And that is where I want to share some of my experiences. So you can see, on the one hand, the good thing that has happened is that this initiative from Ayush and the Prime Minister's intervention made sure that a lot of research proposals came. So much so that it has even been pointed out that COVID-19 has inspired a research culture in Ayush disciplines like never before. And 58 Ayurveda-based COVID-19 trials were registered very early. And it was also found that Ayush clinical trials outnumbered the trials from modern medicine. This is the first time probably in India such a situation is happening. So you can see here there were publications on what is the trend of clinical trials related to COVID-19 in India. And it was found that majority of the trials, 61% were related to Ayush interventions. So I think the Ministry of Ayush was definitely successful in bringing a research culture within the Ayush community. And the strong presence, has been very much highlighted. Traditional medicines dominate COVID-19 vaccine trials over allopathic. And that. But now if you look at the actual publications that are available, if you just look at the PubMed database, which is also only one of the databases that are available, we have 42 research publications related to Ayurveda and COVID-19, little more when you take the whole of Ayush, but Ayurveda still dominates the scenario. And in a short while, I will show what kind of studies are there, what kind of outcomes are already there. Many trials are still in process. And many of the data that are being presented are pre-publication data. So we have to wait some more time before we get really peer-reviewed, credible, good quality publications. They are all in the pipeline and in the process. From what is already available, I want to point out, before we give a snapshot of what has happened, I want to point out one area where we need to give more attention to. I mean, under the initiative of Dr. Geeta Krishnan, very early in March, April, some of us sat together and tried to create an Ayurvedic understanding of COVID-19, Ayurvedic clinical profiling. I mean, here we are not just looking at whether a herb can interfere with the virus, it will have an antiviral activity, or whether it will, boost the immunity or suppress it, or that's not the way we thought. We tried to build an Ayurvedic clinical profiling. How, from an Ayurvedic point of view, we can understand COVID-19, and how on that basis we can develop a protocol that will offer, individualized treatment approaches to COVID-19 patients in different stages. And this is it's beyond the scope of our current presentation to give details of this, but this paper is, published and available, and there are many, theoretical and clinical profiling elements that we brought into this that would help an Ayurvedic physician to understand what type of treatment, what type of intervention would be most suited for a patient that comes to him, because this is one of the biggest challenges in clinical practice. Every patient may be different. If you do not have a theoretical framework to understand why different patients are presenting in different way and on what basis we can choose the best treatment available. So clinical profiling is a very, very important thing. And I'm happy to say that after our publication, other people have also tried to, profile it from different angles. And this is in the process of development. And I want to point out as an example, some of the cases which we have been following up based on the whole system Ayurveda. And generally there has been a public perception that Ayurveda is good for mild and moderate cases and severe cases should be referred. But I have to tell frankly, in my opinion, in the state of Kerala where I am based, we don't have permission to treat severe any kind of COVID patients. So I have had to collaborate with many clinicians in the country. We held a lot of meetings and clinical discussions, looked at their outcomes. And what I have found in cities like Mumbai, Chennai, where patients are not even able to get entry into allopathic hospitals, severe cases have come to Ayurvedic physicians. And some of them even had to be given treatment in allopathic hospital when they didn't have access to oxygen. And the results are amazing. This is one of those cases which we reported as a clinical outcome, is a case of a patient with severe hypoxia who was admitted in an allopathic hospital and was not responding. 2 days, the patient was getting worse. The SpO2 was very low, around 80. And then, as you can see here, this is a very individualized treatment regimen that we followed based on Ayurvedic guidelines and Ayurvedic profiling of the disease. And the results are amazing. Within 4 or 5 days of start of Ayurvedic intervention, the SpO2 levels became normal. The patient could be weaned off, oxygen. And this patient was obese, had high CRP levels. So there were all indications and risk that this patient could go into severe COVID and complications. But, she recovered dramatically with Ayurvedic treatment. So what I wanted to point out is that there is a very important need to also look at, when we look at research, we must spread the net wide. We must look at the problem from both the biomedical interdisciplinary framework and also from the classical Ayurvedic framework, where Ayurveda offers a unique way of looking at the pandemic, clinically classifying it. Recently from King's College, London, researchers found that there are 6 clusters of COVID-19, and each of them may have a different, prognostic outlook. This is very similar to the Ayurvedic approach of understanding such diseases. And so some of us, we also wrote about this experience. What is the relevance of Ayurveda's whole system approach to health and disease management? So what I want to say is that on the one hand, research in Ayurveda and Ayush systems have gone in the interdisciplinary approach, which is a very rigorous scientific way of doing research. And I'm sure this is also going to be definitely very helpful and fruitful. And as the results come, we are going to see the benefits of such an approach. But this is inspired more by understanding Ayurveda from the framework of modern medicine. So single herbs or simple formulations are actually used. And on the other hand, we also have practitioner outcomes, which we need to encourage. We need to encourage practitioners to start reporting their clinical outcomes, and we also get a lot of rich understanding of what Ayurveda can do. So many practitioners, and many of them are now beginning to publish their case reports and case series. And I'm sure in the next months, we will have a better idea of how these two approaches, what are the advantages and shortcomings of these two approaches. One is the whole system approach of Ayurveda, and the other is the interdisciplinary approach to research. So many publications are coming in, clinical study of an Ayurveda regimen in COVID-19 patients. And when it comes to the classical approach, modern scientific approach, there are a lot of in silico studies, but not as many in vitro studies, because access to the virus and laboratory facilities are lacking. Even though the task force really tried to push that up, we don't have access to SARS-CoV-2 virus so easily. So most of the studies are dominating are in silico studies, and a lot of such studies have found that many herbs that are commonly used in Ayurvedic system do exhibit antiviral properties. And then there is research also on immunomodulatory effects, because I just pointed out that framework in which research is being done from an interdisciplinary point of view. And we have examples in all those areas. There are also public health approach has also been explored, and there has been publications regarding what is the role of Ayurveda and what is the potential areas where Ayurveda can work as a public health initiative. And then also integrative approaches, how Ayush protocols can be integrated to the standard modern medicine protocol, because that's also very important in a pluralistic healthcare setup like India. Many people have come up with pragmatic plans for Ayurvedic interventions, and they have been published, and they are guiding Ayurveda clinicians. Ministry of Ayush itself brought out guidelines for Ayurvedic practitioners. So what I wanted to point out here today is that there are these two approaches of research that has happened. The one which has been more officially promoted is based on this traditional concept of evidence. And this is where, as Geeta Krishnan said, this kind of approach to evidence sometimes creates barriers. This prevents practitioners from immediately responding to a pandemic, and also sometimes prevents practitioners from taking the freedom to look at the disease from a traditional Ayurvedic epistemological point of view. But when the pandemic escalated, such barriers were broken. And this is the point I want to make, that those barriers were broken, and clinicians have had amazing experiences with not only mild and moderate COVID, but with severe COVID cases also. But we really need to understand in what are the strengths and limitations, and for that, elaborate documentation and clinical report, outcome reporting is going to be very, very crucial. And yet another area where I think is very much important, I want to point out a futuristic area of importance is long COVID or post-COVID syndrome. Even in India now, this is beginning to be reported. And long COVID is also as complex as COVID itself. It's not one single condition. And some of our initial analysis of long COVID shows that there is a scope for profiling long COVID also from an Ayurvedic perspective. Like, for example, Ayurveda says Sannipada Jwara means ojas is lost, Hrida Ojasam. And the main symptom in long COVID is crippling fatigue, which seems to correspond exactly with the Ayurvedic idea of Ojakshaya or Hridauja state of Sannipada Jwara. So it looks like in long COVID also we can adopt, apart from this classical, the traditional interdisciplinary approach, an approach to understand and profile the disease from an Ayurvedic perspective, and then develop treatments. So these are all the potential areas. And today in my presentation, I wanted to really discuss about this, two-pronged approaches, the conflicts that happened, and how research on Ayush in the context of COVID-19 unfolded. And I think in the future, this has very important lessons for to teach us, especially the importance of looking at the whole system perspective of traditional systems of medicine and nurturing and facilitating research and clinical practice from that whole systems approach. So with this, I would like to conclude, and I thank the organizers for giving me this opportunity to share my views during this conference.
Dear Ram, thanks a lot for your contributions. Are very important. You have shared a broad view of the situation of the research, a novel place about COVID, but where Ayurveda has a lot of contributions to offer to all the world. Thanks a lot. And we know that you have a very specific view, and you are working a lot about integrating Ayurveda with modern medicine, promoting research, but this research taking care to promote Ayurveda, to have a full respect for Ayurvedic epistemology, as you have said. Thanks for that.
Thank you.
Thanks a lot, Dr. Ramanhar. We appreciate your participation in this webinar and all the wonderful information that you shared with us. A lot of people is writing in the YouTube chat that they appreciate all the information about the evidence. So thank you very much. Okay, so thank you. Vamos a tomar una pausa de 5 minutos para que podamos ponernos de pie, estirarnos, también para darle una pausa a los intérpretes quienes nos están apoyando con la traducción en el canal de la BSMTCI en español. Entonces vamos a tomar 5 minutos de pausa y ya volvemos con la doctora Tanusha Nesari, que nos va a hablar acerca de las experiencias. Me perdí acá en el programa.
Hacemos la pausa, sí, y después seguimos.
La pausa primero. Ok, perfecto. Muy bien, 5 minutos de pausa. Estamos en una pausa de 5 minutos, ya retornamos. Muy bien, estamos volviendo.
Hola a todos de vuelta. Un gusto continuar con esta actividad. Y les vamos a comentar algunos cambios y adaptaciones. Vamos a enseguida compartir con ustedes una aclaración de la doctora Tanuja Nesari en cuanto al material que presentó. Y después vamos a tener el gusto de que nos va a acompañar el doctor Prasad Vinjamuri presentando el panorama de la Ayurveda en el campo de la salud pública en los Estados Unidos. El doctor Anup Thakar, el rector de la Gujarat Ayurved University, tiene problemas para poder acceder. En otro momento nos hará llegar su presentación. Y después tienen ahí los siguientes expositores. Quiero compartir, un minuto por favor. ¿Puedo compartir yo, Natalia, ahora? Frente a algunas preguntas que surgieron ante esta diapositiva de la doctora Tanuja Nesari, que realmente hizo una presentación impactante, nos han estado comentando esto por el canal de YouTube, los dos canales. Acá hay un tema donde ustedes ven la población total cubierta por la profilaxis masiva. Acá es 549.449 personas. No sabemos si fue un error de expresión o de interpretación. No son 5.490.000, sino son 549.449 personas. Acá este es un sistema diferente de puntuación que utilizan en la India, que son lakhs. 5 lakhs son de a 100.000, 500.000, y en otro momento ya mencionó crores, que son 10 millones. Simplemente esto para aclarar, para que no se haya una mala interpretación o una mala difusión de los datos. Les repito, 549.000 personas cubiertas con esta profilaxis masiva. Aldana.
Muy bien. Entonces damos la bienvenida al doctor Prasad. Denme un segundo, comparto la pantalla. Creo que, momento. Dr. Prasad Vinjamuri, he is a professor at the Southern California University of Health and Science, teaching Ayurveda and traditional Chinese medicine. He also provides acupuncture and Ayurveda medicine service at the University Healthcare. He is the Director of Integrative and Family Health Service at SCU Health, and he is a board member of the National Ayurvedic Medical Association. He is the past president of the Integrative, Complementary and Traditional Health Practice of the ICTHP section of the American Public Health Association. He has over 25 years in clinical experience integrating Ayurveda, traditional Chinese medicine, and Western diagnostic methods. And he has done a lot of contributions to the bridge between the TCIM, the Traditional Complementary Integrative Medicine, in the field of public health. For us, it's also an honor that Dr. Prasad Vinjamuri is sharing his knowledge and his experience and his kindness in this webinar. So welcome, welcome, Prasad.
Thank you. Thank you very much. So can I share my screen?
Yes, now you can.
Okay. Excellent. Okay. All right. Thank you very much for this opportunity to share. Thank you for the invitation from TCIM Americas. It's really a great honor and privilege to present and share the US perspective at this important conference. The topic given for my presentation is overview of Ayurveda in the public health field, and also overview of Ayurveda in the United States. So to demonstrate the role of Ayurveda in public health in the United States, I thought that it is appropriate to explore if Ayurveda was used as a health promotion tool during COVID-19 in the United States, hence the extension of the title. So we also added that Ayurveda for COVID-19 in the United States and how it is done. So you'll be surprised like why this Ayurveda for COVID. So that is something which in order to describe about public health, so I had to include that. So I'll start my presentation with a brief overview of Ayurveda in the United States and the levels of Ayurveda education and practice. Then I'll discuss how Ayurveda is part of the integrative complementary and traditional health practices section within the American Public Health Association. Finally, I'll present the preliminary findings of our IU COVID survey, which we just initiated, and it is still in the we're still in the process of collecting data. Just have some preliminary data, which I'll try to do. I'll present that and conclude this presentation. So to capture the status of Ayurveda in the United States, it's important to know the number of users of Ayurveda in the United States. The National Health Information Survey conducted by the CDC annually includes what is called a CAM supplement, complementary and alternative medicine supplement, which is considered now as complementary integrative health supplement. Once in 5 years, it's also attached along with the National Health Information Survey and over 33,000 people are called in person by these people and conducted by the CDC and to collect various health status of people of the United States. And once in 5 years, they specifically ask questions about the usage of complementary integrative practices are included in this particular survey. Based on this survey, the number of users as of 2012 is still a minuscule of US population, which is 0.1%, which remained the same 0.1% even after up to 2012. But there is definitely a slight increase in the number of Ayurveda users along with time, although it is still 0.1% of the US population. But what I want to say is that the survey conducted in 2017, for which the data is still not published by anybody, Ayurveda users was not retrieved. It might have been more because of the increased interest in yoga and Ayurveda in the last 3 to 5 years, based on my observation. Also, the data from the increase in the number of users of yoga and meditation, the 2017 survey, which that data for the yoga users and meditation users is out, but not the Ayurveda users. Somebody has to retrieve from this huge database and have to start working on it. So based on that, you will see that there's a big jump from 9.5% users to 14.3% users of yoga in 2017. Same thing for meditation. You could see there are only 4.1% of US population was using meditation, and they just became 14.2%. There's a big jump in yoga and Ayurveda, yoga and meditation. So as you know, most Ayurveda users learn about Ayurveda in this country through yoga. And although this trend is changing recently because of many integrative health and medicine organizations and news items, as well as the popularity of ashwagandha, there's a product, the patent product KSM66, which is an ashwagandha root extract by Exorial Biomed, is very popular within the dietary supplement industry, that many patients ask for ashwagandha or directly purchase it over the counter and thereby explore or learn a little bit about Ayurveda and also seek Ayurveda care. This product entered the market, entered the US market sometime in 2000 or so. So I'm guessing that the number of users of Ayurveda would have also increased since 2012. In the 2017 survey, there should be at least 1% or so of the population, which was something similar to traditional Chinese medicine. When it started, it had something like that. Okay, so that's about the the number of users, and also to give you another snapshot of what is happening about Ayurveda in the United States. In the largest Ayurveda organization, NAMA, which is the National Ayurvedic Medical Association, which represents the Ayurvedic profession in the United States, also had a big growth in the last decade from over 500 members. It now doubled and has over 1,000 members, which is something really very good to note. And it's mainly the primary goals of this particular organization are to support Ayurveda education and professional practice. And it has it elects 12 board members and has various committees working on various aspects of Ayurveda education, as well as improving the professional practice. A quick review of the timeline of the birth and growth of NAMA indicates that between 2000 and 2020, it has grown into a complete professional organization on par with any other healthcare organization, healthcare profession, and as full-time executive director and employees that run the organization and assist the board of directors in creating standards of education guidelines and conduct annual meeting that brings together all Ayurveda professionals to learn and discuss about education, practice, and research in Ayurveda. In the United States, or for any country, health profession attains recognition if there is a professional organization that is strong and advocates for their members. And I can proudly say that NAMA is currently serving this role of becoming a strong professional organization for Ayurveda in this country, which is really very helpful. As many of you are already aware about the Ayurveda education system in the United States, Ayurveda education is still at certificate level programs, and there are only a couple of institutions that offer a degree program that lead to a master's degree or a doctoral degree. Currently, there are 3 levels of these certificates: Ayurveda health counselor, similar to a health coach in conventional medicine, and which requires a minimum of 600 hours of education. And then an Ayurveda, which basically is mostly with this particular certificate, the professionals are involved or in education and counseling about Ayurvedic concepts and theories and the simple health promotion techniques and disease prevention techniques. They do not do much of herbal treatments yet. And then an Ayurvedic practitioner level course is for they get trained for a minimum of 1,500 and up to some institutions go up to 2,000 hours, which includes all the scope of practice includes all that which is under the AHC, which is the health counselor, plus they do some amount of Ayurvedic diagnosis and management of some illnesses, which are simple illnesses using some herbal preparations, and a few Panchakarma techniques also, like Virechana, they do that. And they also get an opportunity to work with other providers. The last category of training that leads to Ayurvedic doctor is being offered by a couple of institutions and is in different forms. One institution gives a certificate and another one offers a doctoral degree. It is still evolving at this time. A major hurdle for establishment of more advanced level education that offer degrees is the return on investment for students in this country. Students may not be able to recover the cost of education of the higher levels of education without a license right away, because the license defines the scope of practice as well as which gives them some kind of safety as well. Of course, it also indicates that there is a safety from the patient perspective as well. So without that, to get and invest for 4,000 hours of education in Ayurveda, it's still a little difficult in this particular, in our country right now. As part of its advocacy efforts to receive licensing, NAMA has set up a certification board to create, standardize, and offer rigorous certification exams. Passing these exams that are administered by a third-party professional test developing and delivery organization, it demonstrates entry-level competencies obtained by the exam taker for his or her level of practice, whether it is AHC, AP, or AD. A profession that is well organized in terms of standards of education and certification, that is competency-based, will be able to advocate for licensing. So that is the main goal for the NAMA certification board. I'm a board member of this certification board as well. It may also create a pathway to demonstrate safety, as well as perhaps will increase the demand from the public once they see that the profession is organized and has got some standards and some certification exams. Of course, it's not conducted by the state yet, but it is being, the profession by itself is organizing itself in order to do this, which is kind of very important. So these are the two certificates which are currently being provided. Ayurveda Health Counselor as well as Ayurveda Practitioner. Ayurveda Doctor is coming soon, and it is still under development and expected in spring 2021. Okay, so that's about Ayurveda in the United States, a brief overview. Now going into the Ayurveda in the public health field. So to talk about the public health, we cannot just skip the role of American Public Health Association. In the United States, American Public Health Association is a 150-year-old organization which is which champions the health of all people and all communities. This organization has 31 sections based on major public health disciplines such as medical section, international health section, epidemiology section, as well as program-based sections such as maternal and child health, community health, workers section, disability section, etc. One of these 31 sections is the integrative, complementary, and traditional health practices section. Currently, it has around 500 members, or just over 500 members, which is basically its main purpose is to pursue clinical care, research, teaching, advocacy, policy making, and health promotion related to integrative, complementary, traditional health practices, which is one of the systems of medicine that is part of this ICTHP, which is the integrative, complementary, traditional health practices within American Public Health Association, is Ayurveda. So it is currently linked between Ayurveda and public health in the United States. That's, although there are something happening at an individual level, but an institutional level and organizational level, I would say that this is one of the biggest link where Ayurveda is being promoted within public health in the United States. Ayurveda professionals are active members of this section and have been leaders of this section, and have held the section chair position, program planning chair positions, awards chair positions, and various other leadership positions. And as part of the during annual meeting of APHA, several oral and poster presentation on Ayurveda have been made at this venue, which has increased the visibility of Ayurveda within the public health community, so people come to know about it. Some of the topics include the daily and seasonal routine, which is Dinacharya and Rutucharya, Rasayana, Ayurveda for pain, and there are always tons of yoga topic presentations, which really create some interest about Ayush systems within the US. So just to give an example of its work, the ICTHP work, the leaders of this section decided to explore the role of the integrative traditional health systems, including Ayurveda, in health promotion. As we all know, a successful health promotion program must be simple, cost-effective, and more importantly, culturally and geographically appropriate, that encourages community participation. We believe that Ayurveda and other integrative traditional systems of medicine meet these requirements and are part of many cultures, but have never been promoted as health promotion tools in any of the national policies or guidelines. And not even in the corporate level, also corporate policies or guidelines or any place, we did not see them. Some of these are occasionally added as footnotes sometimes, but do not have a prominent position in the policies. One of them, which is so close enough, is yoga, something being promoted as one of the traditional health practice, which needs to be for health promotion. So ICTHP, along with like-minded integrative health organizations, pledged to collaborate in developing a position statement specifically to advocate the inclusion of integrative health practices such as Ayurveda, traditional Chinese medicine, and yoga for health promotion in all health policies during APHA's annual meeting in November 2018. So based on this, we subsequently developed a position statement and presented it at in Australia at the International Complementary and Integrative Health Conference, where we developed this position statement where it states our specific position is that integrative health practices must be included in all health promotion policies explicitly. Current available evidence clearly indicates that there is benefit from these integrative health practices at the level of primary prevention. As you saw since morning or evening, wherever you are located, recent clinical trials on Ayurveda and similar many clinical trials on traditional Chinese medicine, which originated from China. The effect of these systems on COVID-19 have demonstrated its role in primary prevention. In addition to the use of natural products, these practices include diet and lifestyle guidance and stress mitigation techniques and improve sleep quality. Most of these interventions are evidence-based. At this point, we are in the process of retrieving evidence on all these guidelines and practices. And I'm hitting a roadblock when I especially look for some research on dinacharya, ritucharya, and diet lifestyle based on Ayurveda principles. Very limited number of studies are there, regardless current evidence. So if any of you could help me with that, it'd really be very helpful so that we can include that component of Ayurveda's contribution for health promotion as well. Regardless, current evidence does warrant its inclusion in the health promotion policies and guidelines. So to summarize, the ICTHP section continues to work with existing global partners and is interested to work with new global partners or organizations or governments that are exploring to collect evidence on the role of integrative health practices such as Ayurveda in promoting public health. Perhaps in the future, we could specifically determine how much Ayurveda is being used for health promotion in the United States. With this in mind, we conducted a survey of Ayurveda professionals in the United States, and we named it as AYU COVID survey. So the specific purpose of this survey is to understand the utilization of Ayurveda for health promotion by Ayurveda professionals practicing in the United States during COVID-19. So this is my last section of my presentation. So another 5 minutes, I'll be done. So this is what we mean by Ayurveda professionals is to include all the 3 levels of education, what you mentioned. So that's why we don't have the word Ayurveda practitioners alone, because there also counseling is considered to be a health promotional tool as well. So it was an online survey, which was included 20 items, included demographics and administered via SurveyMonkey. And we tried to recruit nationwide via email, as well as also contacting practitioners by phone, as well as social media. And the study was approved by the Southern California University of Health Sciences, IRB. And it is definitely a confidential and anonymous survey because we do not know who is responding, and we don't want to identify people so that they can give their opinion more confidently. And we did say that responding to the survey implied in their consent to participate in the survey. So all those who were practicing Ayurveda were included, and if they are having client interaction, they were asked to continue. If they did not, then we said thank you for your time. And people from either sex or any age, all ethnicities, all were welcome and included in the survey. If they are not an Ayurvedic professional, or if they are not in the United States, they were excluded. So at this point, we have 43, and when I checked in the morning, it was 47. So I'm slowly expecting that it's going to go up to 100 people at least, because now I'm sending out an email to all the professionals, so then the numbers might increase. Predominantly, they were females, mostly from California, obviously, and the most of them identified themselves between 41 and 50, and their level of education training, mostly Ayurvedic practitioners. Ayurveda practitioners responded more than the other levels, but although there were respondents from all the groups. Most of them mentioned that they have been in practice for the last 1 to 5 years, which is something really very important to note, and its influence on the final results. And there were also questions about the impact of COVID on Ayurveda practice. They did mention that there was an impact, economic impact, which they did say that it negatively impacted them, and then Ayurvedic practitioners were quick enough to adopt telehealth. Some of them subscribed to new methods. They supported, the majority of them said that they have supported between 0 to 25 or 1 to 25 people, clients within this, during this period. And there were also people who gave up to, treated or provided care, about 100 people were also provided. So as I mentioned, they did adopt telehealth. And then this is something really important. What is the primary area of support? They were asked to pick, check all that applies. So most of them mentioned that they did provide health promotion and disease prevention as the main area of support using Ayurveda. And then second one is mental health support. Although there were other supportive care as well as support other symptoms related to lockdown, quarantine, and self-isolation were also given, like fatigue or tiredness or whatever they were talking about. So how was your practice affected by COVID? When we asked, most of them saw that there is an increase in patients during the pandemic, which was something similar to what we have seen in India. Also that there was such a great demand, which you heard, so those who responded said until now that they definitely saw an increase in the patients during the pandemic, which is something similar in my private practice as well as in the university-based practice as well. Suddenly there is an increase in patients seeking Ayurveda and Chinese medicine care. Economic impact, I already mentioned that there was an economic impact, negative economic impact, although there is growth in percentage of patients, but that was only for a smaller number of people, but most of them did have a lesser number of people. What services and advice did you offer when they were asked? So diet, lifestyle, and Ayurvedic herbs were the top 3 choices, although there are all other types. And we also wanted to know whether people are aware about Indian government Ayush Ministry guidelines. Only 5 people responded and said that they did adopt those. How often did you suggest the following lifestyle behavior advice to your clients? And you can see that deep breathing, pranayama, and outdoor activities were advised more often. And they also discussed about fostering relationships, the healthy relationship with family and friends more often. So you can see this is always, they were talking more, and walking, outdoor activities always, and then deep breathing always. So you can see that these are something more often suggested by people. And we also wanted to know specifically Ayurveda-based lifestyle advices, which they were all suggesting. And here is Dinacharya, which is specific daily routine, and specific dietary advice people were offering, as well as drinking hot water or coriander water. Tea was more often and always suggested advice by these practitioners, although there were others which were sometimes were also suggested. Some of these, most of these, as you can see, that these are also part of the Ayush guidelines, because instead of asking them as Ayush guidelines, we wanted to ask specifically, highlight what within those guidelines these practitioners were using often. And also we asked about the Ayurvedic formulas. Chyawanprash was only advised sometimes, but custom herbal formula as well as classical Ayurvedic formulas were more often advised. Again, you can see that often and always, these are the 2 which are more often and always suggested when compared to Chyawanprash, which was sometimes. And then also COVID specific Ayurveda supplements made and sold by a US based Ayurveda pharmacy that are very big Ayurveda pharmacies here, which you can see sometimes and often they also use those. OTC supplements and non-Ayurveda herbs, where you can see that never or very rarely they used it, but not as often as these particular products. We just wanted to know, because Ayurveda here, people are more drawn towards OTC supplements, over-the-counter supplements. So when we were asked about the clinical outcomes from their perspective, what it was, so they did mention that their patients remained overall healthy with no COVID diagnosis. As you can see, 80 to 100% of their, and only developed mild health related symptoms, COVID-related symptoms, and required concurrent biomedical care. None were more, and nobody actually developed non-COVID symptoms, which is really very important. And COVID-19 symptoms also improved. You could see that 80 to 90% of their clients. There are some clients who really improved as well. I'll summarize them later. And finally, public health role of Ayurveda, when they were asked, and they all felt that there is a definitive role for public health of Ayurveda. So summary of Ayurveda COVID is Ayurveda services for health promotion and disease prevention during COVID-19 is there. Majority of respondents mentioned Ayurveda lifestyle, diet, and herbs were more often advised during COVID. Daily routine and drinking hot water or coriander tea were more common lifestyle advices for health promotion, and custom formulas and classical Ayurvedic formulas were more often advised than Ayurveda supplements sold by US-based Ayurveda pharmacies and OTC supplements. Respondents reported that none or less than 20% of clients either developed COVID-related symptoms, which is something really good, which is showing that Ayurveda has got a very definitive role in health promotion during this time. And they also mentioned that very few required concurrent biomedical care or developed non-COVID-19 related symptoms, because it's not only prevented COVID-19 from an Ayurvedic practitioner's perspective, it also prevented non-COVID-19 related symptoms and to keep their health well. Some of them reported that COVID-19 symptoms improved when Ayurveda was added as a supportive care as well, which is something really, again, similar to what we saw from India data. And they all believe that Ayurveda has a role in public health. So we have to interpret this particular data cautiously, because it's a self-reported perception from the practitioners, and there could be some recall bias because it's something we are asking that happened in the past. And it's just a very small sample of practitioners, although it's representative of the nation, but it is mostly California-based respondents. And also most of these respondents were part-time practitioners, which is also has a big influence over the results. 20% or less of their time is spent in Ayurveda practice is what they mentioned when we asked them. And that they did also see only a very small number of clients during this period. Nevertheless, they still found that it was helpful as a health promotion tool. So in conclusion, Ayurveda is gradually becoming popular in the United States. Licensing will remain a dream for some more time, but it is an important health tool for health promotion and disease prevention due to its emphasis on diet and lifestyle and natural products, which are very easy and very easy to adopt. And Ayurveda practitioners in the US are contributing to health promotion during COVID-19. I'm proud to say that, even though it is in a limited way, but they have definitely started moving the clock in that direction. I would like to acknowledge my colleague, Dr. Nabarikova, who was the co-investigator of the study and the SU Ayurveda department and the director of the program, Dr. Anu, and all the participants who responded, and Nama, who agreed to send the survey questionnaire to all the members of NAMA. Thank you. Sorry, it took a little longer than expected.
Thank you a lot, Prasad. A wonderful presentation, a lot of information. And as I told before to everyone, Prasad is one of the persons who has been working with that bridge that is so necessary between the public health and the TCIM. And some of the information that he shared with us today show to everyone how important are the contributions of the TCIM, including Ayurvedic medicine, in the public health field. So thank you very much for that.
Thank you. I appreciate an opportunity to present.
Prasad, thanks a lot. Thanks
Thank you.
a lot for your cooperation and for your presence here in this webinar. Happy
Thank
Diwali to you.
Happy Diwali to you too. Thank you for it.
Ok, es un gran honor presentar en este momento y adaptar el programa. Recién estaba intercambiando. Hay un dicho en la India que dice, amen mi incertidumbre, y creo que eso es la mejor manera para poder adaptarse al estrés. Quiero agradecer la presencia en este momento de la doctora Mandip Goyal, representando al doctor Anup Thakar, que es el rector de la Gujarat Ayurved University y particularmente del Instituto de Posgrado de Investigación y Enseñanza de la Ayurveda, que, como les dije, ayer fue declarado por el primer ministro de la India como instituto de importancia nacional. La doctora Mandip Goyal es una profesora asociada en el Departamento de Clínica Médica del Instituto de Posgrado. Es una profesional con mucha claridad para la enseñanza y con muchísimo empuje. Tiene 19 años de experiencia en investigación y enseñanza. Ha publicado 103 artículos médicos y colaborado en 17 capítulos en diferentes libros. Es la editora en jefe de AYUSH Journal, otro de los revistas indexadas en el PubMed en el campo de Ayurveda. Es investigadora principal del Centro Colaborativo de la OMS, que es el Instituto de Posgrado, en diferentes áreas, incluyendo también ha participado en el trabajo de Ayurved Genomics. Y actualmente también ha colaborado, ha sido la coordinadora de los lineamientos de tratamiento ayurvédico que se ha presentado por el Ministerio de AYUSH. Como les dije, ella va a estar representando al doctor Anup Thakar, que ha tenido un inconveniente técnico y sin lugar a dudas va a ser un excelente reemplazo del doctor Thakar. Doctora Mandip Goyal, usted puede ahora habilitar su video y el sonido. Dr. Mandip, you could, yes, please. Hello, doctor. Happy Diwali to you.
Thank you, Dr. Bera. Actually, Dr. Anup is being busy with some of the work, and so he asked me to present the activities which we are carrying out related to COVID-19 at our institute. As you have rightly said, yesterday only our institute has been given a new name, though on my slide the old name appears. We have been given a National Importance Institute and renamed as Institute of Teaching and Research in Ayurveda. So I give my greetings from Jamnagar, Gujarat to all of you, the expert in this webinar. So as the slide is showing, that with the starting of the outbreak of the COVID-19, there were so many activities which were going on as a part of AYUSH to see whether Ayurveda has any role in the management of the COVID-19, or there is any role of Ayurveda in the prevention, or it may be helpful as an add-on treatment. So looking at these things, there were many types of clinical trials which were thought of and it were planned. And
Doctora, sorry, one question.
Yes.
Sorry,
yes.
Just one comment. Para
Yes.
toda la audiencia, en India se está festejando en este momento el Año Nuevo. Y como en muchos lugares del mundo, cuando se festeja el Año Nuevo, hay muchos fuegos artificiales. Eso es lo que están ustedes escuchando en este momento durante la presentación de la doctora. Gracias, doctora, por hacer el esfuerzo de estar con nosotros en este momento especial del Año Nuevo de la India. Gracias.
Yes, we are celebrating Diwali here, and it's lots of firework outside. And so I'm trying to present with little bit of sounds. Sorry for that. So shall I continue with my presentation?
Yes, of course, please.
Yes, yes. So in the beginning, because Jamnagar is a small city away from the capital part of Gujarat, in the beginning, we did not have any cases of COVID-19. And so the first study we started at our institute was a retrospective cohort study, where we tried to trace the patients who were admitted at the Samras Hospital of Ahmedabad and tried to find out whether there was any role of Ayurveda as an add-on treatment. The data is what were generated, I will be sharing in the next slide. The second clinical trial, what we started once the lockdown was open, and then we started getting cases in Jamnagar also. So it was a trial which was carried out in collaboration with the Modern Hospital, where we added one of the Ayurvedic polyherbal formulation, IU64, to the ongoing treatment, modern conventional treatment in the hospital, and tried to see whether adding of any types of Ayurvedic management is helping in the symptoms of the patients of COVID, or it is helping to bring down the days of the symptoms, or there is any changes in the mortality rate. And the third project we started, that usually we think prevention is better than the cure. So in the third clinical trial, we added, we gave Guduchidan to those persons who were at high risk as men, and try to see the effect of these. And recently we have also started one more project where we are working with WHO CRO New Delhi, where we will be trying to publish a systematic review and meta-analysis of all types of work or the clinical trials, which will be published in a PubMed or a peer-reviewed journals, to see how the effect of the various clinical trials, the various parameters of COVID-19 has been studied, and what is the overall effect of those medicines. So the next slide, it is talking about the first trial, what I just spoke about. It was not the trial we conducted, it was a retrospective cohort study, where the patients who were admitted to Samras COVID Care Center at Ahmedabad, they were interviewed after they had completed the treatment, and they were asked about the questions which were planned as a questionnaire of this project. And on the telephonic and the data which was kept in the hospital was analyzed. And there we try to see the patients. There were two groups of the patients who were treated in that hospital. One were that they were given only the modern drugs. That is mainly what was the guideline at that time for the COVID-19 patient. That is vitamin C, antibiotics, etc. Considering the cases or considering the symptoms what the patient of the COVID-19 had. And in the other groups, there were certain patients who agreed to take additional Ayurveda management. And there at that time, Ayush had given a guideline for giving Ayurvedic treatment to the cases of COVID-19, whether they were symptomatic or asymptomatic, but they were COVID positive. So there a decoction of Dashmul and Pathyadi along with the Trikatu powder was given. Also Sanshamni Ghanvati and IU64 tablets were added to this treatment. Along with that, Yashimadu Ghan tablet was also given for chewing. So as this was a retrospective cohort study, the data was collected and the analysis was done. And total 762 patients were taken into the analysis, where out of that 541 were in the group where they were given Ayurvedic medicine as an add-on therapy to the modern treatment, where in other group they were just taking the modern drugs and they did not take any of the Ayurvedic management, or they did not follow any of the guidelines which were given by the Ayush or the Ayurveda practitioners. So the outcome were analyzed on the basis of what was the incidence and relative risk of developing symptoms, and whether the total duration of symptomatic phases of the COVID cases were affected or not by taking add-on or just taking the modern medicine. So the first objective, when we tried to do the analysis, it was found that there was no association between add-on treatment and incidence of the symptom, as the risk ratio was 0.89. But when we try to see the effect on the total duration of the symptom, it was decreased significantly in the group where where Ayurvedic drug was added along with the ongoing conventional treatment. And so it could be seen that if the Ayurvedic drugs are added along with the modern treatment, the total duration of the symptomatic phase may be reduced. And the third objective, what was considered, was incidence and relative risk of oxygen therapy use. So we tried to find out from the data from the history of the patient, how many of the patient required oxygen during the treatment in either of the group, and it was found that patient exposed to add-on Ayurveda therapy had 0.78 times lower risk of oxygen use. Though this was insignificant, but it was giving a hint that if proper management is started with the Ayurvedic treatment at proper time, in a mild to moderate cases of COVID-19, there will be more chances that patient recover faster, and there will be less chances of the use of the oxygen therapy. So it was this is concluded because the study has already been cohort study we have just completed, and we have put this into for the process of the publication in the journal. The conclusion we try to put on the data is that exposure of Ayurvedic treatment as an add-on treatment might be more effective in the cases of COVID-19 patient as compared to the standalone conventional care. This may provide to identify the potential drug candidates from Ayurveda treatment and provide the evidence for further clinical use for COVID-19 patient. Because this was a multiple drug conditions where we gave 2 types of the decoction and the tablets, 2 types of tablets and something for the chewing. So later on, the studies may be carried out where we may do the groups and decide which of the decoction or which of the tablets and drugs will be better to which cases or the which stages of the COVID-19. So it remains a part of the clinical trial for the future. But however, the study indicated that there is some role of Ayurveda as add-on in the cases of asymptomatic to symptomatic mild cases of COVID-19. The second trial which we carried out, just I have said, after the outbreaks of COVID-19 in Jamnagar, where we started getting the cases and the patients were admitted in the modern hospital just opposite to our Ayurvedic hospital. So with the permission of the hospital, we again planned a study where we tried to add a AYUSH 64, which is a polyherbal formulation, again, which is being prepared by CCRS in CCRS, and it contains some of the drugs which have potent anti-fever and anti-influenza or flu type of action. So this was selected, and following the procedures of all this ethical provisions, we started a clinical trial where the patients who were admitted in the Guru Gobind Singh Government Hospital, Jamnagar, within 48 hours of their admission of hospital, they were asymptomatic to mild cases of COVID-19, but they were RT-PCR positive cases. And this was again a single center, open label, randomized parallel arm controlled clinical trial, where we try to find out whether addition of AYUSH 64 as an add-on of standard of care on improvement has any role in the improvement in the different parameters in early stage of COVID-19 patient, and to see whether there is a clinical safety of AYUSH 64 in the cases of COVID-19. So as I have said, one of the group was where we tried to add AYUSH 64 2 tablets, which was 500 mg each thrice a daily after meal, along with water for 14 days as an add-on treatment. 14 days was decided as the admission at that time as per the guidelines of the ICMR was 14 days for hospitalization of the cases of COVID-19. And so in the beginning, we started with 14 days treatment where all the drugs which were given by the physicians in the modern hospital were allowed to continue along with the addition of the AYUSH 64. And in the second group, we did not interfere with the management which was given by the modern hospital physicians, where we just observed the patient who were taking this treatment and whether they had any change in the condition when they are not taking any type of Ayurvedic treatment. And the primary outcome which we planned was to see whether change in the daily state of WHO ordinal scale for clinical improvement and whether any ventilator or oxygen supply was required by the patient or not, or whether there was any types of mortality during the treatment of either of the groups. This was the primary outcomes we observed. And in this clinical trial, we could do only complete only 37 patients in either of the group due to some of the restriction of the hospitals. And whatever data was generated in these 37 patients, each of either add-on or standalone group, it was analyzed on the parameters what we have just discussed before. So the first parameter was to see the effect of the trial on the WHO ordinal scale for the clinical improvement. The graph is showing here that in the beginning, there was nearly the similar changes, but it was found after the 7th day of the treatment with the add-on of Ayurvedic treatment to the modern drug, the comparatively better effect in the symptoms were found, and it was also statistically significant. Later on, the number of the patient who developed COVID-19 patient, because it was we had taken asymptomatic cases also of COVID-19. It was seen that out of 8 cases, 6 patients developed COVID in the group A, which was an add-on treatment, while in another group, it was from the 10, 11 cases developed the symptom. But this the results could not be show any statistical effects on this because maybe the sample size was small. And similarly in the use of the oxygen therapy, no statistical difference was found between the groups. But when the total duration of the symptomatic phase was seen, it was found that in the group A, which was a add-on group, the mean days from 4.68 reduced to 3.29, and it was statistically significant. The other parameters which were also done along with the symptoms, the parameters related to the biochemistry, the D-dimer, CRP, IgE, ferritin, and ESR, that also showed significant changes in 2 or 3 parameters, that is the D-dimer and CRP. However, the statistical difference between the 2 groups was not seen. Maybe the number of the samples reported were less for these cases. And from this study, it was concluded, this was just a pilot study which was planned. It was concluded that AYUSH 64 as an add-on of standard of care in early stage of COVID-19 provided rapid improvement in the symptoms in comparison to the standard of care alone, and the drug AYUSH 64 was also safe as an add-on treatment because we had added this treatment along with the modern drugs, and there was no type of any complications were seen when the patients were taking both Ayurveda drugs and the modern drugs together for the management of the COVID-19. The third study was a study where it was planned to give Guduchi Ghanvati as a prophylactic measure among the populations who were at high risk to the COVID-19 exposure. And there it was a non-randomized open label control interventional study, and where a sample size of 20,000 cases was studied. And it was again a multi-centrical trial where the patients or the persons who were at the high risk of the exposure to COVID-19 at the Jamnagar, Ahmedabad, Baroda, and Gandhinagar, Bhavnagar, which are the cities of the Gujarat, were studied. And these total 21,939 cases of the patients were screened of that. And total subjects who could complete the whole protocol of this prophylactic study was 20,000. And the data has been generated, but because the analysis of this data has not been done, the results cannot be shared at this moment. But whatever results were found, it could be said that the cases who had already taken this Guduchi Ghanvati during their exposure to COVID-19, they had less incidence of developing of COVID-19. And because with the starting of the COVID-19, the AYUSH has started many efforts to produce evidence for the clinical evidences to show that Ayurveda drug has got some role either as a standalone or as an add-on. Lots of work are already going on, and they will be published soon and will be available in the public domain. So looking at the things, once it is there, and there are so much information scattered in the form of various clinical trials which are carried at different parts of India, specifically in Ayush systems of medicine, a need of systemic analysis and meta-analysis of these results is required. And so as soon as the publications will be available, a systemic analysis of these will be done. And this is also taken as a part of WHO activity at Jamnagar, because Jamnagar is WHO collaborating center. And so when because whatever I discussed, it was our study which we carried out at our institute in collaboration with different modern hospitals and Ayurvedic centers in Gujarat. As soon there will be many studies completed at different parts of India, and so we will be in better condition to say what is the actual role of Ayurveda in the cases of COVID-19 patient. So with this, I would end my presentation. And thanks Dr. Bera and his team for allowing me to share my, on behalf of Dr. Anup, the experiences at Institute of Teaching and Research at Jamnagar. Thank you all.
Dr. Mandeep Goyal, thanks a lot for your presentation. It has been very interesting. Really, we want to know the results of all the research on Guduchi and all the other Ayurvedic remedies. Really, it will be a very important contribution for the knowledge of how to work with COVID-19. And also, thanks again for your participation in this very special day in India. At least you have shared some feeling of India with these firecrackers, and we are smiling a lot. Thanks for that. And please convey our regards to Dr. Anup Thakkar and all our friends at Jamnagar University, and congratulations for being an institute of national importance. Thank you so much. Happy Diwali to you.
Thank you, Doctor.
Natalia.
Thank you. Entonces, ahora para continuar nuestro programa académico, sigue el doctor Johan Perdomo. Denme un segundo para compartir acá la pantalla. Muy bien. Denme un segundo. Muy bien. Entonces, el doctor Johan Perdomo, él es médico especialista de primer y segundo grado en medicina natural y tradicional, tiene un máster en medicina bioenergética y natural de la APS, es profesor auxiliar de la Facultad Manuel Fajardo de la Universidad de Ciencias Médicas de La Habana, es investigador auxiliar y es el jefe del Departamento y Grupo Nacional de Medicina Natural y Tradicional del Ministerio de Salud Pública de la República de Cuba. El doctor Johan Perdomo, bueno, en Cuba ellos tienen algunas dificultades técnicas con la conexión, por lo cual hicimos un pregrabado hace 2 días para garantizar que si de manera presencial no se podía conectar, pues poder estar acompañándonos. Entonces, denme un minuto para compartir el audio. Muy bien. Me confirman si ahí el audio, si Zoom está dejando compartir el audio del equipo.
No, todavía. No, la pantalla sí, pero no todavía.
A todos los colegas de la red de medicina tradicional, complementaria, integrativa.
¿Ahora sí?
Sí, perfecto.
Perfecto.
Sí, hola, buen día a todos los colegas de la red de medicina tradicional, complementaria, integrativa de las Américas. en nombre del Ministerio de Salud Pública de mi país, agradecemos la oportunidad de poder estar compartiendo este webinar acerca de el tema de Ayurveda, y vamos a estar concretamente hablando de las experiencias de trabajo conjunto entre el Ministerio de AYUSH de la India y el Ministerio de Salud Pública de Cuba. Nosotros, con la historia de Ayurveda, una historia milenaria, apenas en 3 años desde el inicio del acercamiento a Ayurveda, estamos como que dando los primeros pasos aún, pasos que, como en lo personal he dicho en otros momentos, confiamos que sirvan para que Ayurveda permanezca en nuestro país al menos el mismo tiempo que ha estado en la historia de la India. Vamos a estar hablando dos personas, iniciando en nombre del Ministerio de Salud Pública. Voy a estar presentando las experiencias en general de trabajo, y me sigue la doctora Thais Show Martínez, una especialista en medicina natural y tradicional que elabora en el Centro Internacional de Salud de la Pradera, que es donde está enclavado nuestro primer centro de medicina ayurvédica acá en Cuba. Decir que nosotros comenzamos el acercamiento al tema de Ayurveda a partir de una visita realizada a la India por el entonces ministro de Salud Pública, el doctor Roberto Morales Ojeda. En esa gira por algunos países de la región, el ministro visitó el Ministerio de AYUSH y tuvo un intercambio con el ministro de AYUSH, el excelentísimo señor Shripad Yesonai, y esto fue el inicio del acercamiento a Ayurveda. Habíamos tenido en el año 2015 una delegación del Ministerio de AYUSH que había estado en Cuba, y incluso ellos participaron en un evento sobre farmacología de productos naturales con nosotros, pero fue a partir de esta visita en el año 2017 que comenzó el acercamiento ya a Ayurveda. Inmediatamente de esta visita, a partir del año 2017, en diciembre, comenzó a visitar nuestro país el doctor Srinivas Efmadi Acharya, que es un profesor, un reconocido profesional de medicina ayurvédica en la India, y que ha estado brindando asesoramiento a nuestro Ministerio de Salud Pública en estos temas. Él ha estado visitando regularmente Cuba desde el mes de diciembre del año 2017. En ese momento se realizaron un grupo de conferencias, y utilizando las propias palabras del profesor Acharya, el objetivo de estos primeros intercambios fue sensibilizar a los profesionales de la salud con temas de Ayurveda. Realizamos un grupo de conferencias en instituciones de prestigio de nuestro país, y esto facilitó un primer acercamiento a estos temas. Participaron médicos, farmacéuticos, rehabilitadores, enfermeros, de forma general, todos los profesionales que pudieran de alguna forma tributar al desarrollo de Ayurveda, por supuesto directivos del sistema de salud también. A partir de este primer viaje se coordinaron entonces un grupo de actividades que se han venido desarrollando a lo largo del año 2018-19, y bueno, tuvimos una actividad a principios del 20, pero evidentemente este año, con la afectación de la COVID, hemos estado cerrados como ha sucedido en el mundo. Concretamente se han desarrollado 2 cursos talleres de Abhyanga, niveles 1 y 2. Estos fueron orientados fundamentalmente a médicos especialistas en medicina natural y tradicional acá del país. Se realizaron 2 cursos de Ayurveda, niveles 1 y 2, donde se formaron ya no solo médicos, sino participaron también, pudiéramos decir, los terapistas, incluyendo aquí licenciados en rehabilitación y personal de enfermería. Igualmente participaron también farmacéuticos e investigadores vinculados al tema de las plantas medicinales. Estos fueron en el nivel 1. Ya el segundo nivel fue puntualmente para los médicos y terapistas. El doctor Acharya también participó en dos importantes congresos que celebramos en el año 2018, la Convención Cuba Salud, que es nuestra convención de salud pública, donde él participó en un simposio sobre el desarrollo de la medicina natural y tradicional, presentando una conferencia del impacto de Ayurveda en los sistemas sanitarios. Y bueno, nos acompañó también en el Bionat, que es nuestro congreso de la Sociedad Cubana de Medicina Bioenergética y Naturalista, donde hubo representantes de la red, tuvimos incluso acompañamiento de directivos de la sede central de la OPS, y acá estuvo también el doctor Acharya. Podemos ver cómo dentro de las actividades desarrolladas se realizaron visitas a escenarios naturales para buscar la identificación de plantas medicinales de uso en Ayurveda, que esto lo mismo se hacía en la ciudad que en el campo. Esta es una imagen que estamos compartiendo, donde ahí nos acompaña además la doctora Concepción Campa Huergo, y el núcleo del trabajo ha sido también el asesoramiento y el desarrollo de actividad asistencial en el Centro Internacional de Salud de la Pradera, de lo cual va a estar hablando posteriormente la doctora Thais. Un elemento muy importante, y evidentemente es un compromiso entre ambos países, fue que durante la visita en el mes de junio de 2018 a Cuba, del presidente de la República de la India, en el marco de esa visita oficial, se firmó un memorando de entendimiento entre el Ministerio de Salud Pública y el Ministerio de AYUSH para la cooperación en el área de los sistemas médicos tradicionales y homeopatía, que este ha sido el marco por el cual se ha venido ya trabajando desde el año 2018, apenas 6 meses después de la visita de nuestro ministro. Ya se estaba firmando este memorando de entendimiento, y es lo que ha marcado el trabajo que se ha venido realizando en Cuba. Nosotros hemos realizado además una visita de una delegación del Ministerio de Salud Pública a la India, con el objetivo de intercambiar y ganar en experiencia, donde sin duda el secretario de AYUSH y los demás miembros del equipo de este ministerio pudieron ofrecernos una visión de cómo poder hacer avanzar el tema de Ayurveda en Cuba, y también enviamos un grupo de especialistas, 3 especialistas nuestros a la India, que estuvieron también familiarizándose con estos trabajos. Nosotros hemos venido desde el año 2018 celebrando en Cuba el Día de Ayurveda, 13 de noviembre en este año, y la primera celebración del Día de Ayurveda tuvimos el honor de contar con la participación de la embajadora de la India acá en Cuba, y se celebró en el SEGMET, en la sede de nuestra autoridad reguladora de medicamentos. Hemos venido ya desde el 2018 de manera sistemática celebrando el Día de Ayurveda, que constituye un momento para poder divulgar y sensibilizar en la importancia de esta práctica médica, que no por milenaria deja de tener un significativo valor a la luz del siglo XXI y todos los retos que tiene la salud pública en estos momentos a nivel mundial. Y bueno, el primer centro de Ayurveda en Cuba fue inaugurado el 6 de noviembre del año 2019. La doctora Thais va a estar hablando acerca del tema. Al momento de la inauguración, el ya viceprimer ministro Morales le cedió el honor de cortar la cinta al profesor Acharya, que ha sido de alguna forma el embajador de Ayurveda para nosotros. Y estas son algunas imágenes del día de la inauguración. Cuba, en el año 2019, a través de una resolución ministerial, certificó o aprobó la inclusión de Ayurveda como una modalidad de la medicina natural y tradicional dentro del sistema de salud. reconociendo a Ayurveda como un sistema médico tradicional con un enfoque integral y científico basado en la sabiduría ancestral, la experiencia clínica y la investigación, que actualmente se desarrolla en los paradigmas contemporáneos de la ciencia y la tecnología y que tiene en cuenta el cumplimiento en el orden legal de los requerimientos previstos en la resolución 381 del 2015, que es la resolución que regula las prácticas de la medicina natural y tradicional en Cuba. Nosotros acá teníamos hasta el año 2019 10 modalidades reguladas y Ayurveda, a partir de esta resolución 452 del 2019, pasa a ser la 11ª modalidad de la medicina natural y tradicional regulada en Cuba. Ahora, cuando hablamos de tradición y hablamos de ciencia, en algunas mentes pudiera parecer que esto es un puente, pero que el puente está roto. Nosotros vemos que el paso de la medicina tradicional tiene un componente basado en la tradición, pero tiene un componente basado en la evidencia científica y se puede viajar de un lado a otro sin ninguna dificultad. En un momento determinado, cuando nos preguntaban cuánta ciencia podía haber detrás de Ayurveda, se nos ocurrió hacer una búsqueda en Google académico, 15 años del 2015 al 2019, y nada más y nada menos que con Ayurveda aparecen en Google académico 59.400 resultados. O sea, hay evidentemente una generación de publicaciones, de investigación y de datos científicos que respaldan Ayurveda. Pero igual, cuando usted en el mismo buscador, en el mismo periodo de tiempo, usted hace una búsqueda y agrega clinical trial, o sea, ensayos clínicos, aparecen 17.100 resultados con estas palabras claves. Evidentemente, Ayurveda es tradición, pero Ayurveda es también ciencia, como en esencia su nombre significa ciencia para la vida, y de eso es de lo que se trata. Nosotros vemos el futuro de Ayurveda, en primer lugar, en la capacitación y formación de recursos humanos nuestros, en la necesidad de fortalecer el Centro Internacional de Salud de la Pradera, que es nuestro único escenario actualmente, y en la extensión gradual, según las posibilidades de estos servicios a otras instituciones sanitarias del país. También la necesidad de investigar para, a partir de las posibilidades y del contexto cubano, poder generar nuestras propias evidencias. Ahora hablábamos, Thais y yo, al inicio de vernos hoy en la mañana, de un proyecto que queremos estar llevando en este sentido, y sobre todo poder contribuir a divulgar los beneficios de Ayurveda, tanto para los profesionales sanitarios como para el público general, porque si bien la homeopatía y otras modalidades de la medicina tradicional estaban arraigadas en Cuba, Ayurveda constituye un nuevo elemento que estamos incorporando en nuestro sistema sanitario, y es necesario conocer el alcance y los beneficios que representa este milenario sistema de tratamiento y sobre todo preservación de la salud, que es el énfasis de Ayurveda. Y nos proponemos continuar el desarrollo de Ayurveda por esta imagen. Esta no es la imagen típica de una institución sanitaria. Ahí está la doctora Thais con una paciente y un acompañante acabado de realizar un tratamiento, un masaje a Vianga, y es evidente cómo un paciente y un terapeuta con su acompañante, con esa cara de felicidad, evidentemente tiene que haber una mejoría. De esto se trata Ayurveda. Esto pudiera ser el rostro de la Ayurveda, y nuestro principal objetivo es poder ayudar a las personas que lo necesitan.
Muy bien, a continuación vienen las palabras de la doctora que nos indicaban acá. Denme un segundo. La doctora Thais, aquí ya estamos alistando. Un momento.
adicional, complementaria e integrativa, le habla la doctora Daí, especialista en medicina natural y tradicional. Entonces vamos a comenzar hablando del Centro de Medicina Ayurveda, el cual se encuentra enclavado en el Centro Internacional de Salud La Pradera, por lo que es importante mencionar que es un centro de rehabilitación integral tanto para niños como para adultos, donde reciben rehabilitación neurológica, ortopédica, cardiovascular. También se reciben pacientes con cáncer, se hacen tratamientos de diabéticos, entre otros. Y bueno, es importante mencionar que el centro se creó un 6 de noviembre del 2019, conmemorándose un año de su inauguración este pasado 6. Por lo que es de relevante importancia mencionar este centro, el cual tiene como principal propósito pues expandir gradualmente en todas nuestras instituciones de salud nacional en nuestro país. Entonces, el Centro de Medicina Ayurveda, creado el 6 de noviembre, contó con toda la ayuda de todo nuestro Sistema Nacional de Salud y además se hizo un memorando de entendimiento que ya se había mencionado anteriormente con el Ministerio de AYUSH de la India. La Embajada de la India también colaboró. Tuvimos como asesor principal al doctor Srinivas Acharya, el cual se ha mantenido en todas las actividades de capacitación, campamentos, del cual hablaremos a continuación. También recibimos durante aproximadamente 5 semanas la colaboración de una doctora especialista en terapias de desintoxicación de Panchakarma, la doctora Raskala Patil, y 2 terapistas de Kerala, que fueron de una inmensa ayuda para nuestra capacitación de tanto los médicos como los terapistas y enfermeras del centro. Entonces, las principales perspectivas del Centro de Ayurveda, bueno, fundamentalmente es organizar proyectos de investigación, tanto de las principales patologías como las plantas medicinales, formulaciones ayurvédicas y otros medicamentos ayurvédicos propiamente que se emplean en la India y que podemos obtener también en nuestro país. Capacitar, como ya habíamos hablado, a los médicos y terapeutas en cuanto a esta especialidad de medicina ayurvédica y expandir su uso para diferentes hospitales y áreas de atención secundaria y atención primaria también. Para esto, bueno, debemos coordinar acciones entre los 2 ministerios y también promover la creación de aceites esenciales en Cuba propiamente. Para ello contamos con dos casas fundamentalmente, el Centro de Medicina Ayurveda, la Casa Charaka y la Casa Dhanvantari, que está dividida en 10 locales propiamente. 8 locales que son propiamente de terapia, es decir, 4 en la Casa Dhanvantari y la otra en Charaka, y 2 locales de sauna, uno donde el paciente se encuentra acostado y otro donde el paciente se encuentra sentado. Posterior al tratamiento, siempre el paciente recibe una recuperación que puede ser al aire libre o puede ser bajo techo. Para ello contamos con 2 áreas respectivamente. También se cuenta en cada casa un local de dispensario, uno en la Casa Dhanvantari y otro en Charaka, un área de elaboración de alimentos y un comedor donde los pacientes reciben una dieta o alimentación ayurvédica que van a ver más adelante los resultados de cada campamento y tratamientos recibidos, cómo ha sido en cuanto a esta alimentación. También contamos con 18 habitaciones porque los pacientes deben permanecer en nuestra área según las orientaciones indicadas previas al tratamiento y posteriores al tratamiento. En cuanto a las personas de material humano, contamos con 2 médicos especialistas en primer grado de medicina natural y tradicional que se encuentran en formación en esta especialidad de Ayurveda, 2 especialistas en servicios farmacéuticos y plantas medicinales, 10 licenciados en rehabilitación, 2 en el área de enfermería, un chef de cocina internacional y un especialista en nutrición que trabaja conjuntamente con el chef, el médico y auxiliar de cocina y gastronomía. Para el servicio de capacitación que ya antes había mencionado por el doctor Johan, se han realizado diversos cursos, entre ellos los que iniciaron desde el año 2017 a finales de este año, cursos de masaje Abhyanga, donde han sido talleres teóricos con prácticas, y se han hecho 2 cursos de Ayurveda, nivel 1 y nivel 2. Este último se realizó en nuestro Centro Internacional de Salud La Pradera, capacitando de este modo todo el personal de rehabilitación, médico y de enfermería. Entonces, en las experiencias obtenidas ha sido relevante mencionar que hemos participado en jornadas científicas tanto en ese centro como en centros de nuestro país en cuanto a medicina ayurveda. Se han realizado 3 campamentos propiamente de panchakama o desintoxicación. Y entre un campamento y otro hemos visto algunos pacientes, así que llamamos intercampamentos. También se ha recibido adiestramiento con médicos y terapeutas de la India, ya mencionado. Y bueno, nos mantenemos en un intercambio de retroalimentación de manera regular con los asesores de la India, dígase los terapistas, el doctor Acharya. Entonces, también hemos perfeccionado el dominio de técnicas aprendidas durante este periodo a través de prácticas, tanto en las terapias con los pacientes como en docencias propiamente en nuestro centro. Y bueno, nuestro principal objetivo es incrementar el arsenal terapéutico a través de, como habíamos dicho, plantas medicinales, formulaciones y medicamentos propiamente ayurvédicos. Es importante resaltar que las patologías más tratadas durante estos campamentos o terapias fueron alteraciones propiamente del sistema osteomiarticular. También vimos pacientes con neoplasias, trastornos de tiroides y otras como hipertensión, diabetes. Entre los otros, que fueron los que más predominaron, son diagnósticos diversos como Parkinson, diversas enfermedades del tejido conectivo, miopía, temblores, epilepsia, obesidad. Nos gustaría, es decir, mostrarles los resultados de los diversos campamentos que hemos tenido, donde se observa un predominio de las terapias realizadas. Vemos que hubo un predominio de meditación, de los 2 tipos de masaje, masaje Abhyanga y masaje Udvartana. También, como habíamos dicho antes, la dieta ayurvédica predominó, que es esencial durante todo el periodo de desintoxicación de estos pacientes, es decir, durante todo el tratamiento, desde un inicio hasta el final, y se recomienda mantenerlo posteriormente. También predominó las terapias de fomentación, que incluyen la sauna y todas las terapias de suedana, que es la fomentación donde utilizamos terapias con pindas, dígase pindas con plantas, pindas con arroz y leche u otro tipo de material que el paciente requiera en ese momento. En el campamento siguiente, pues el predominio fue muy similar: meditación, el masaje, la alimentación y suedana de igual manera. En el tercero, el mismo, con un predominio de las meditaciones y la alimentación y el masaje. Es importante resaltar que el 75% de los pacientes tuvo un diagnóstico satisfactorio, es decir, que hubo una mejoría de los síntomas de un 75 a un 100%, y solo un 25% de ellos tuvieron una satisfacción moderada, es decir, que no tuvieron una remisión total de estos síntomas, sino hasta aproximadamente un 75%. Entonces, nos hemos mantenido trabajando, pero es decir, intermitente en relación a las condiciones higiénico-epidemiológicas en que nos encontramos debido a la pandemia, a la COVID-19, por lo cual hemos realizado un apoyo en nuestro país a diferentes áreas de salud para la realización de pesquisa en la búsqueda de casos positivos. En este momento nos encontramos ya retornando a la normalidad de nuestro centro y se continúa en su desarrollo de la medicina ayurveda, tanto en su capacitación como el trabajo con los pacientes y la docencia. A continuación quería mostrarle algunas imágenes donde se evidencia la inauguración del centro el año anterior, 6 de noviembre del 2019, donde podemos ver algunas figuras significativas de nuestro país, como el viceministro, el ministro de Salud Pública, la doctora Concepción Campa, el doctor Johan Perdomo, la embajadora de la India, el asesor Isniva Acharya y la doctora Ráscala, que nos acompañó en el adiestramiento en Cuba. A continuación los mismos que habíamos mencionado en la casa de Panchakam, Madame Bantari House, aquí haciendo terapias de Abhyanga. La imagen a la izquierda se utiliza, es una terapia de marma que se utiliza previa a la Abhyanga, y en la siguiente vemos una terapia de Nasya, donde se aplica masaje sobre los marmas de igual manera. Y por último, una terapia de Shirodhara, solo para que vean la imagen, que se utiliza de manera regular para trastornos neurológicos e insomnio. Eso es bueno. De manera general ha sido todo y agradecemos su presencia. Muchas gracias.
Muy bien, muchas gracias a todos. Como les comentábamos, los colegas de Cuba tienen algunas situaciones técnicas con la conexión. Sabemos que algunos están haciendo preguntas por el chat acerca de los profesionales de salud que están interviniendo y cómo se hizo el proceso de colección de las plantas. Ya remitimos estas preguntas a Cuba, pero no logran conectarse en este momento para poder dar las respuestas. Tan pronto las tengamos, las dejaremos en el chat o buscaremos pues una forma de hacerlos. Igual quiero aprovechar para comentar que todos los videos de las ponencias quedarán en los dos canales de YouTube y posteriormente en la BBC MTCI Américas encontrarán las memorias del evento en el tipo video, no las slides, no las presentaciones, pero sí los videos donde cada uno de los conferencistas está haciendo su ponencia y con la opción de poner subtítulos, leyendas, para que puedan poner la traducción al idioma que necesiten. Entonces, vamos a continuación a dar, un momento, comparto pantalla. Vamos a continuación a dar la palabra a Daniel Amado, quien es el actual coordinador de la Política Nacional de Prácticas Integrativas y Complementarias en el Sistema Único de Salud del Ministerio de Salud de Brasil. Es consultor del Ministerio de Salud desde 2011 y ha trabajado en este campo desde 2003. Daniel Amado nos va a contar acerca de las experiencias de integración en el SUS de la Ayurveda. I am seeing that we don't have a English translation of the Spanish in the English channel, so the following speaker is Daniel Amado, who is the director of the National Policy of Integrative Practice in Health of the Unique Health System of the Ministry of Health in Brazil. So he will talk about the integration and articulation of the TCIN in the health system of Brazil. So please, Daniel.
Perdón, Natalia, un comentario. Sí hay traducción en inglés en este momento. Está funcionando, activa. Para que de acuerdo al canal pueden elegir. Gracias y Daniel, un abrazo.
Daniel, adelante, bem-vindo.
Olá a todos, boa tarde. Né? Primeiro, parabenizar, né, já uma das últimas apresentações, toda a rede MTCI, né, especialmente a Natália e o Jorge, né, por toda a organização aí do evento. Eu vou compartilhar agora a minha tela. Vocês enxergam?
Sí, se ve perfecto, Daniel.
Obrigado. Então, eu vou falar da Política Nacional de Práticas Integrativas e Complementares no Sistema Único de Saúde, né, que é o Sistema Público de Saúde do Brasil. Né? O Brasil é um país que tem cerca de 210 milhões de brasileiros, né? É um país com uma certa, né, com extensão grande, uma população, né, grande também, não tão grande quanto a Índia, mas nós temos um sistema, né, público de saúde integrado, né, no país, onde o nosso modelo de atenção está fortemente baseado na oferta de atenção primária, né? Então 65% praticamente da população é coberta pela, né, estratégia de saúde da família, que é o nosso modelo de atenção primária, e o que contempla cerca de 42 mil equipes, né, de atenção primária, né, em todo o território nacional. Essa equipe de saúde da família era composta, né, por médicos, enfermeiros, técnicos de enfermagem e agentes comunitários de saúde. Então, quando eu for falar mais à frente da integração das medicinas tradicionais complementares e integrativas, eles estão inseridos dentro desse sistema, né? São essas as equipes, principalmente, que vão ofertar, né, as práticas integrativas, como chamamos aqui no Brasil. Os times também, né, as equipes também podem ser formadas, né, com um componente de saúde bucal, onde também é composto por dentistas, né, e técnicos de saúde bucal, e também a possibilidade de outros profissionais de saúde, né, a partir de um núcleo de apoio à saúde da família, que trazem outros profissionais para completar essas equipes. As práticas integrativas, elas se integram no SUS desde o começo da sua história. Então, houve uma grande conferência em 1986, né, que foi a 8ª Conferência Nacional de Saúde, onde se traçou os princípios e as diretrizes do que seria o nosso sistema de saúde, pois naquela época se estava discutindo a Constituição do Brasil, né, o documento da Constituição do Brasil, que foi publicado 2 anos depois. E na Constituição traz, né, a saúde como um direito, né, e um dever do Estado, aonde ele organiza, né, a oferta desse né, serviço de saúde para a população. Já em 1988, já saem as primeiras resoluções de uma comissão interministerial de planejamento, aonde traz algumas práticas né, para a oferta nesse sistema de saúde. Então, a acupuntura estava prevista nesse momento, o uso de plantas medicinais e fitoterapia, a homeopatia, o termalismo, além de, né, naquele momento, chamadas práticas alternativas em saúde mental. E diversas discussões são realizadas desde então, né, em todas as conferências nacionais de saúde que acontecem a cada 4 anos, né, se tem um novo pleito, né, de integração dessas práticas no sistema de saúde, nesse sistema público, mas somente em 2003 é que se monta um grupo de trabalho no Ministério da Saúde para elaborar uma política que ia se chamar à época de política de medicina natural e práticas complementares, né? A partir de um conjunto de discussão, né, dentro do Ministério e no Conselho Nacional de Saúde, um órgão, né, de controle social da política de saúde, eles definem um novo nome para a política, e ela, em 2006, depois de um processo de amplo debate, ele é publicado como a Política Nacional de Práticas Integrativas e Complementares no SUS. Então, a política nacional ela está inserida, então, nesse sistema de medicina convencional, né? Ele está inserido dentro de um sistema já organizado, com oferta e com profissionais que, né, estudam e conhecem a medicina tradicional, a medicina convencional, mas eles trazem a possibilidade de incorporar e implementar, né, as práticas integrativas complementares nesse sistema de saúde, né, trazendo um incremento do acesso da população a essas práticas de cuidado, contribuindo, e tem como objetivo contribuir com o aumento da eficiência do sistema, com a resolutividade do sistema, Então, o objetivo dessas práticas não é criar um sistema alternativo ou chamado um sistema de duas portas, onde a pessoa pode, né, escolher um acesso a uma terapia alternativa ou, né, não convencional e um sistema convencional. Mas essas práticas estarem integradas, onde os profissionais que ofertam a medicina convencional também tenham conhecimento das práticas integrativas e complementares. Então, é um dos objetivos também que, a partir da oferta de outros olhares de cuidado em saúde, né, dentro desse sistema, que esse sistema ele se torne mais eficiente, né? E com isso a gente também tenha um melhor uso do sistema. Então, se eu tenho, principalmente na atenção primária, né, uma oferta maior de práticas e um olhar ampliado sobre o cuidado, eu consigo tratar melhor dessa comunidade, dessa população, que vai ter uma necessidade menor de exames, por exemplo, de alta complexidade, ou de uma hipermedicalização, né, de consulta com especialistas. Então, a gente consegue, principalmente na atenção primária, né, ser mais resolutivo. Mas essas práticas elas estão previstas também, né, nos 3 níveis de atenção. Nós temos práticas integrativas também no sistema, né, na média complexidade, assim como na alta complexidade. Então, nos hospitais, nós também temos essas práticas. Então, é objetivo atuar na prevenção, na promoção, na assistência e na reabilitação utilizando essas práticas. E um dos objetivos também é fortalecimento da participação da comunidade na construção das políticas de saúde. Hoje, no Brasil, temos cerca de 17 mil estabelecimentos de saúde que ofertam práticas integrativas, mais 15%, ou 15 mil estabelecimentos, cerca de 90% deles, estão na atenção primária. São 4.200 municípios, né, que ofertam essas práticas. Então, cerca de 77% dos municípios do Brasil têm ao menos uma oferta de prática para a população. Segundo o dado do cadastro, né, da atenção primária, cerca de 5% da população brasileira, né, utiliza práticas integrativas. Então, isso, cerca de 10 milhões de brasileiros têm, né, se beneficiado dessas práticas. A política nacional ela é instituída em 2006, né, com 5 práticas: a medicina tradicional chinesa, né, e a acupuntura, a homeopatia, as plantas medicinais, a antroposofia e o termalismo. Então, foram as primeiras práticas que foram implementadas, né, em 2017. Então, 11 anos depois, né, a partir da avaliação das práticas que já estavam sendo utilizadas no território, a partir do reconhecimento das categorias profissionais, né, das evidências científicas que tinha no campo, né, foi ampliada essa política, onde entra, né, por exemplo, a Ayurveda. A Ayurveda passa a compor o nosso sistema oficial de saúde a partir de 2017, assim como a naturopatia, que também tem, né, na Índia, a meditação e o yoga, né, além de outras práticas, destacando aqui uma prática que foi desenvolvida no Brasil, que é a terapia comunitária integrativa, né? No ano seguinte, em 2018, também foi ampliado em mais 10 práticas, né, incluindo a terapia, a aromaterapia, né, entre outras práticas. Especificamente sobre o Ayurveda Yoga e a homeopatia, no SUS, do Ayurveda, entre 2017 e 2019, foram ofertados 2.500 atendimentos, né? Desculpe que eu coloquei serviço, são atendimentos. Em relação ao yoga, né, 107 mil sessões de yoga foram, né, oferecidas nesse período 2017 a 2019, e já considerando a homeopatia nesse período, né, foram 72 mil atendimentos registrados de oferta dessas práticas. Em termos de pesquisa, nós estamos, né, em relação ao Covid, nós temos uma parceria, né, a Universidade Federal do Estado de São Paulo e a Universidade Federal do Rio de Janeiro, tem uma parceria, né, com a Índia para, né, um estudo clínico, né, do Ayurveda. E também temos um outro estudo em andamento, né, falando sobre a qualidade de vida a partir de práticas do Ayurveda, né, inseridos nessas estratégias de saúde da família. Então, temos alguns estudos iniciais em relação ao Ayurveda. Nós temos alguns serviços de Ayurveda no país, né, alguns antigos, inclusive anterior à própria Constituição do SUS, como o Hospital de Medicina Alternativa de Goiás, né, que é uma referência, né, foi uma referência para serviços de Ayurveda e também de medicina alternativa, porque também contemplava homeopatia e outras práticas, né, e a fitoterapia brasileira também, né, foi um serviço de referência para vários países. Hoje nós temos algumas iniciativas também de implementação do Ayurveda, como essa iniciativa de Araguari, em Minas Gerais, mas ainda o Ayurveda em si é uma prática ainda inicial no Sistema Único de Saúde, né? Nós temos conhecimento de um grande grupo de formação, principalmente de terapeutas ayurvédicos e de massagem ayurvédica, e já um certo número, né, de praticantes de Ayurveda, digamos assim, no país, mas essa inserção no SUS, como eu mostrei nos dados anteriores, ela é ainda pequena. Já o Yoga, a gente tem uma inserção muito mais ampla. A Coordenação Nacional de Práticas Integrativas, né, do Ministério da Saúde, ela atua em 4 eixos estratégicos, né? O primeiro é a qualificação da gestão do sistema público de saúde, onde diversas iniciativas para a formação das equipes das secretarias de saúde dos municípios é essencial para que essas práticas elas se efetivem realmente no território, né? Então, essa é uma grande ação que tem sido realizada pela Coordenação Nacional. Outro trabalho tem sido a inclusão dos protocolos, né, de práticas integrativas em protocolos do Ministério da Saúde. O nosso esforço tem sido de integrar essas práticas nos documentos oficiais do Ministério, onde contempla a medicina convencional, de forma a gente não ter um protocolo, né, separado para as práticas integrativas. Um terceiro eixo é o eixo de pesquisa, onde temos trabalhado com a sistematização das evidências científicas. Então, um grande esforço, considerando, como até, né, alguns colegas anteriores já apresentaram, o grande número de estudos que a gente tem no campo dessas práticas, incluindo o Ayurveda. O nosso objetivo aqui no Brasil é sistematizar, a partir de metodologias, esse conhecimento, essa quantidade de evidência, para facilitar a tomada de decisão, tanto pelos gestores quanto trabalhadores. E aí um ponto que tem sido discutido muito no Brasil são as práticas informadas por evidência, né? Então, termos as evidências como um dos grandes fatores para a tomada de decisão, mas também, né, baseado também nas experiências exitosas que existem, né, de aplicação dessas práticas no território, né, a satisfação do usuário, né? Então, um conjunto de elementos para a tomada de decisão, onde a evidência é, com certeza, um grande pilar para a tomada de decisão. Um quarto eixo, né, da coordenação tem sido o esforço de formação desses profissionais que estão no Sistema Único de Saúde. Então, esse é um modelo de mapa de evidência que foi desenvolvido pelo Centro Latino-Americano da OPAS, né, que trabalha com informação, que é a BIREME. Esse mapa foi produzido pela Rede das Medicinas Tradicionais Complementares das Américas, que já foi abordado em outros webinários, né, aqui nesse mesmo canal, e ele consegue concentrar, né, tanto os desfechos clínicos quanto as intervenções no mapa, onde ele apresenta os principais estudos. Esse aqui foi realizado sobre o Covid. Né? Produzimos, a partir de uma demanda do Ministério da Saúde, em cooperação com a BIREM e o consórcio brasileiro, né, o consórcio acadêmico, né, brasileiro de saúde integrativa, um mapa de evidências sobre a meditação, com mais de 191 revisões sistemáticas, né, sobre com diversos desfechos, e também um mapa de evidências sobre a prática do yoga, com mais de 150 estudos de revisões sistemáticas. Né? O Ministério já selecionou outras práticas, né, para a confecção dos novos mapas, e o Ayurveda, né, entrará na sequência também de produção desses documentos, pois esses documentos são essenciais para que o Ministério da Saúde do Brasil possa estabelecer essas práticas dentro dos protocolos oficiais do Ministério. Esses são documentos de revisão rápida, também produzido, né, esses produzidos pela Fundação Oswaldo Cruz, do Brasil, né, onde, né, ele tem um direcionamento mais específico, como esse que eu apresento de yoga para o tratamento de obesidade e o sobrepeso em adultos e idosos, e um segundo exemplo de meditação mindfulness para tratamento de doenças cardiovasculares. Então, é feita uma síntese de todos os estudos específicos sobre essa intervenção e essa temática. A partir desses materiais, a Coordenação Nacional de Práticas Integrativas tem sistematizado e trazido para uma linguagem que o gestor e o trabalhador do SUS está mais acostumado, né? Assim como a tabela com esses estudos, né? De uma forma organizada, e temos feito a disseminação dessas informações de evidência para os estados, municípios e para os trabalhadores de saúde, no intuito também de eles estabelecerem seus protocolos locais. Essa é a iniciativa de treinamento. Nós temos 6 grandes cursos em uma plataforma virtual de aprendizagem do Sistema Único de Saúde, com mais de 140 mil profissionais, né, participantes desses cursos, que aborda desde a gestão dessas práticas integrativas, então como implementar no serviço, né, essas práticas, há alguns componentes mais técnicos, como o uso de plantas medicinais, né, para prescritores, e outros cursos de sensibilização. Né? Já informamos também que estamos numa fase avançada de produção de um curso de yoga, também curso de meditação, e um curso de Ayurveda que pretendemos estar sendo lançado até o primeiro semestre do ano que vem. Esse é um outro exemplo de formação, aí já com um componente presencial, então a formação, né, com uma parte importante à distância e uma parte prática de forma presencial. É o curso de auriculoterapia, né, do microsistema da orelha, né, da acupuntura, onde nós conseguimos formar 10 mil profissionais da atenção primária em todo o território nacional, e a cada formação que a gente realizava, a gente observava um crescimento dessa produção, da oferta dessa prática no território, então para a população. Em relação à pandemia, nós não temos um protocolo específico do COVID para as medicinas tradicionais complementares e integrativas. O protocolo, até mesmo porque a nossa oferta dessas práticas não abrange, né, apesar de ter espalhado em todo o território, né, em 77% dos municípios, a quantidade de oferta não seria, né, o suficiente para atender toda a população, mas as orientações gerais sobre os atendimentos presenciais e coletivos também atendem a forma de atendimento das práticas integrativas. E aí temos algumas experiências dos estados do Brasil que produziram, né, desde atendimento virtual, né, a partir da internet, né, ou, né, telefônico, e também temos experiências de oferta de diversas materiais educativos para a própria comunidade. Então, desde aulas a partir de vídeos, podcasts, cartilhas, panfletos, né, que foram produzidos pelos estados, tanto para a população ou quanto para a orientação dos profissionais de saúde nessa oferta. Uma outra iniciativa também foi a oferta de práticas integrativas para o cuidado dos profissionais de saúde que estavam na linha de frente do COVID, então como uma forma de cuidado desses profissionais. Mais de 10 cidades também, né, mapeadas, também aprovaram protocolos de homeopatia, e o consórcio acadêmico brasileiro também tem acompanhado, né, a partir de estudos, os resultados dessas cidades que aplicaram esses protocolos de homeopatia. Então, nós temos trabalhado também com diversos parceiros, como eu falei, né, a Biblioteca Virtual em Saúde, que faz parte do Centro Latino-Americano, né, de Informação, a ABIREM, o Consórcio Acadêmico, né, de Saúde Integrativa, que tem produzido os mapas de evidência, e o Observatório Nacional de Práticas Integrativas, que também tem produzido documentos sobre as medicinas tradicionais, complementares e integrativas, neste momento da pandemia, principalmente com o objetivo de divulgar as experiências que estão acontecendo no território, conhecimento para os profissionais de saúde. Então, eu agradeço e fico à disposição.
Muito obrigada, Daniel. Muito obrigada pela colaboração e pela participação hoje. Muito obrigado por o suporte que o Ministério faz para as PICs, para as MTCI.
Desculpa, eu esqueci de mencionar também, né, como já foi falado pelo embaixador da Índia no Brasil, né, que o Ministério da Saúde, né, o Brasil, né, assinou, né, um memorando de entendimento, né, de cooperação com o Ministério do AYUSH para troca, né, de conhecimento no campo das medicinas tradicionais. E nesse sentido, nós, né, temos muito interesse em dar continuidade nesses projetos, reunindo as universidades, né, e as iniciativas no Brasil, seja de pesquisa de serviço, dentro dessa cooperação e, claro, sempre estendendo, né, esse conhecimento, as estratégias do Brasil com a rede MTCI das Américas.
Daniel, felicitaciones por el trabajo realizado. Realmente son un modelo, un ejemplo para todos los países de Latinoamérica particularmente. Es lo que todos anhelamos, que los sistemas médicos tradicionales, complementarios e integrativos estén disponibles y integrados dentro del Sistema Nacional de Salud de cada país. Así que verdaderamente el paso logrado por ustedes es realmente muy, pero muy, muy importante. Gracias por compartirlo.
Obrigado.
Muchas gracias. Entonces, a continuación, nuestro siguiente panelista, y para ya cerrar el webinar del día de hoy, bueno, Jorge, que ha estado acompañando también la moderación del evento, él es médico de la Universidad de Buenos Aires, director de la Fundación de Salud Ayurveda Prema en Argentina, el cual es un centro colaborativo de Gujarat Ayurved University y sede de cátedra Ayurveda del Ministerio de AYUSH de India. Es director de cursos de posgrado en diferentes instituciones académicas de Argentina y ha sido invitado como experto por la Organización Mundial de la Salud y el Ministerio de AYUSH de la India para redactar los lineamientos de la práctica y la enseñanza de la Ayurveda y el Panchakarma. Jorge nos va a compartir acerca de las experiencias de esa articulación que están haciendo la Ayurveda en Argentina. Bienvenido en esta otra faceta, Jorge.
Bueno, muchas gracias. Verdaderamente es un gusto, un honor participar con todo esto. Desde ya también es un gusto participar en la red de medicinas tradicionales complementarias e integrativas de la Biblioteca Virtual de Salud de Vireme, la OPS, y también nos complace mucho el trabajo conjunto con CAPSIN desde la Fundación de Salud Ayurveda Prema. Bien, voy a compartir mi pantalla. Un minuto, por favor. Quiero que me digas, Natalia, si se ve bien.
Perfecto, ahora sí.
Perfecto. Bueno, quiero compartir con ustedes los desafíos que hemos encontrado y que se encuentran en otros lugares en el trabajo de integración de la Ayurveda con la universidad. Primero quiero mencionar los cursos universitarios en Occidente. Desde ya faltan, pero señalar algunos de los que han iniciado en algunos continentes. Por nuestra parte nos tocó en el año 2000 comenzar el primer curso de Ayurveda en una universidad estatal en Occidente, en la Facultad de Medicina de la Universidad de Buenos Aires, y actualmente estamos en la Universidad del Gran Rosario. El doctor Prasad Pinjamuri, que compartió con nosotros desde la Universidad de California del Sur, de la Universidad de Ciencias de la Salud del Sur de California, están desde el año 2009. Ayurveda Academy está integrado con la Middlesex University desde el año 2010, la Universidad de Latvia desde el año 2015, Ayurvedic Point con la Universidad Estatal de Milán desde el año 2007. Y en este momento en Occidente están apareciendo también otros cursos. Para compartir cuál es la situación de la Ayurveda en Latinoamérica, podemos decir que hay diferentes, como los niños, que van desarrollando por áreas, también pasa en nuestro país con el Ayurveda. En Argentina hemos logrado el reconocimiento académico. En Brasil, como lo presentó recién el doctor Daniel Amado, han logrado la inclusión dentro del Sistema Nacional de Salud. En Colombia, por ejemplo, tienen la ley del talento humano que reconoce la medicina ayurveda, mientras que en Costa Rica tenemos oficialmente registrados medicamentos ayurvédicos. Entonces, bien, ¿qué es lo que pasa cuando se introduce la ayurveda en la universidad? Por una parte tenemos que ver con quién, encontramos barreras idiomáticas, hay que delimitar las responsabilidades del equipo, aclarar muchas cosas, ver qué pasa con el material de formación, hablar sobre las plantas medicinales y por último también el reconocimiento del sistema. En el año 2018 y el 2019 la Organización Mundial de la Salud junto con el Ministerio de AYUSH convocó a un grupo de 25 expertos para que redactáramos los lineamientos para la práctica y la enseñanza del Ayurveda y el Panchakarma. Y a lo largo de esta presentación quiero compartir algunos aspectos que hemos trabajado con ellos en un trabajo que tiene que ver con la integración de la Ayurveda con la medicina convencional. Por una parte, para tener idea en dónde estamos, ¿cuál es la opinión de, permiso que voy a, cuál es la idea dentro de las autoridades de la India y las personas más destacadas del Ayurveda en la India? Bien, el 82% de los entrevistados, les quiero decir que éramos representantes de todos los continentes y de muchos países, 25 personas, 23 contestaron el 92%, el 82% está totalmente de acuerdo o muy de acuerdo para que el Ayurveda se integre con la alopatía. Por otra parte también, y esto es una pregunta, un planteo, ¿cómo se integra el Ayurveda con la medicina convencional? El 82% de estos profesionales que contestaron señalaron que el Ayurveda debería ser, o en Occidente sería apropiado, que el Ayurveda sea una especialidad dentro de la medicina convencional. 65,2% muy de acuerdo, 17,4% totalmente de acuerdo con esta expresión. Por otra parte, ¿dónde integrar el Ayurveda en la academia? El 95,6% dice integrarlo en el pregrado y más del 80% señala de hacerlo también a través de cursos de posgrado universitario. En nuestro caso particular, como les dije, comenzamos en el año 2000 con la Facultad de Medicina de la Universidad de Buenos Aires. En este momento tenemos actividades conjuntas, cursos universitarios con la Universidad del Gran Rosario y también de posgrado con la Escuela de Graduados de la Asociación Médica Argentina, y dictamos módulos de Ayurveda en el pregrado en la Facultad de Medicina de la Universidad de El Salvador y también en maestrías y posgrados de la Universidad de Favaloro y la Universidad Belgrano. ¿Qué es lo que pasa? ¿Qué es lo que encontramos con los alumnos que concurren a estos cursos universitarios? Por una parte, acá señalaba una M. ¿Qué es esta M? Esta M, al principio, hace 20 años, nosotros hace 30 años que estamos en la enseñanza de Ayurveda, 20 años a nivel universitario, esta pata de la M, esta parte, era mucho más notoria. ¿Por quiénes estaba compuesta? Por aquellos profesionales que tenían varias décadas de trabajo destacado profesional en la alopatía y sentían que necesitaban buscar otra respuesta para problemas que no sabían cómo manejar. Hoy en día encontramos más parejo esto. Muchos alumnos vienen a los posgrados apenas terminada la carrera, mientras que otros siguen como antes, viniendo después de 2 o 3 décadas de haber practicado la medicina convencional. También encontramos una gran proporción, el 75% de los alumnos son alumnas, son profesionales médicas o de otras profesiones universitarias de la salud, mientras que solamente un 25% son varones. ¿Qué es lo que buscan? Buscan algo para los cuidados personales, algunos vienen por enfermedades, de lo mismo que vienen a los consultorios, otros buscan un enfoque holístico, natural, integrativo, espiritual, complementario, alternativo. Es muy variado todo esto. Y también podemos decir que buscan una medicina nueva o un enfoque diferente. Todas estas expectativas tienen que ser tenidas en cuenta cuando se plantea la currícula. Tiene que ser atendida, tiene que ser respondida. Lo que vemos, los efectos en los profesionales y en los pacientes de la práctica de la Ayurveda, fundamentalmente queremos señalar la reconexión con la vocación médica de los profesionales que llevan varias décadas. Todos los que iniciamos el estudio de la medicina, brota en nosotros una vocación de servicio al más necesitado. Muchas veces por los golpes, por el acorazamiento de la práctica médica, esto queda muy escondido. Y el Ayurveda posibilita reconectar con esta vocación de servicio. Por supuesto, también posibilita una mejor comunicación médico-paciente al entender realmente qué es lo que le pasa. Podemos asegurar sin lugar a dudas que el Ayurveda es muy bien entendido y conceptualmente comprendido por los profesionales de la salud argentinos y latinoamericanos. También amplía la visión, ofrece más recursos y posibilita entender de manera integral lo que pasa con las personas en los momentos de los desequilibrios y de las enfermedades. Y desde ya da muchos recursos que están al alcance de la mano, que son baratos, que son apropiados, que ayudan a transitar mejor los desequilibrios y solucionar las enfermedades. ¿Qué encontramos nosotros? Una barrera idiomática. Podemos señalar, primero, la Ayurveda tiene, de la misma manera que nosotros en Europa en tiempos antiguos el idioma culto era el latín, el idioma culto en el cual se transmite la Ayurveda es el sánscrito. Entonces esto ya establece una barrera. El sánscrito tiene el doble de letras de lo que tiene el alfabeto latino. Esto está traducido al inglés y la realidad es que en la población latinoamericana menos del 5% de la población habla fluidamente inglés. Y entonces nos encontramos que la falta de materiales en nuestros idiomas, en español y en portugués. A partir de eso es indispensable la producción de material local. Nosotros lo hemos hecho por nuestra parte y también acompañados con profesores de la India, ya sea de la Universidad de Gujarat u otros de otras universidades destacadas. También como hay 3 textos muy fundamentales, básicos, fundacionales de la Ayurveda, que son la colección de Charaka, la colección de Susutra y el Bhagavata, que es una condensación de los tratamientos médicos. Estos 2 primeros libros están traducidos íntegramente al castellano. Y como manifestación, como una muestra de este trabajo, como lo presentamos al comienzo de esta actividad, de este webinar, también en colaboración junto con CAPSIN, lo que hemos realizado es un trabajo para favorecer, para poner disponibles los protocolos y las guías del Ministerio de AYUSH para el manejo del COVID. Estos materiales han sido 4 documentos principales y están traducidos en castellano de manera libre para todos, y los van a poder, ya están disponibles en los sitios web de CAPSIN y de la Fundación de Medicina Ayurveda.org. También es muy importante, nosotros hemos tenido que señalar o correr concepciones erróneas. Una concepción errónea, por ejemplo, en el trabajo es que cuando la gente se acerca o entiende que la Ayurveda está en contra de las vacunas. Y lo que les quiero señalar es que en los hospitales ayurvédicos se vacunan, en las universidades, cuando se estudia Ayurveda, se enseñan las vacunas y se enseña cómo aplicarlas. Y justamente, volcando toda esta experiencia, en el año 2015 firmamos con el ministro de Salud de la Argentina una declaración donde señalaba que expertos de homeopatía y de Ayurveda estábamos a favor de las vacunas, y esto fue publicado en el boletín de inmunizaciones de la Organización Mundial de la Salud en agosto del 2015. La otra tema que también uno se enfrenta es quién hace qué. Es muy importante, como el Ayurveda va de la salud, pasando por los desequilibrios a las enfermedades, hay muchas personas que pueden actuar, muchas acciones que se pueden realizar. Entonces el equipo de salud, por ejemplo, está compuesto por médicos, está compuesto por profesionales universitarios como nutricionistas, psicólogos, kinesiólogos, farmacéuticos, y también desde ya en el Ayurveda uno de los pilares son los asistentes, que pueden ser, por ejemplo, técnicos de masaje. Y nosotros señalamos, enfatizamos, marcamos mucho que en todo este trabajo hay que tener total incumbencia, total respeto por las incumbencias profesionales de acuerdo a las leyes nacionales. Hay mucha tarea para todos, los pacientes se van a beneficiar, pero cada cual tiene que abocarse a aquello que sabe y aquello para lo cual está habilitado. El Ayurveda también, para mí, les quiero compartir, para mí el principal problema de la Ayurveda es la vastedad. Y dentro de esta vastedad es muy difícil abarcar todo. Y entonces el Ayurveda, por una parte, tiene sabiduría, esta sabiduría que está relacionada con los principios universales que repican en los corazones y en las mentes de las personas en cualquier tiempo y en cualquier lugar, y también tiene todo un basamento de ciencia. Hoy, por ejemplo, en este webinar hemos compartido mucha información científica de el Ayurveda, y esto tiene que ser planteado de manera apropiada en las currículas de los cursos universitarios de Ayurveda. Por ejemplo, hablando, saben que hay muchos recursos, pero quiero centrarme en alguno específicamente que tiene que ver con los recursos ayurvédicos específicos que son los medicamentos. La farmacopea ayurvédica de la India, que contiene las monografías de plantas medicinales, son 9 volúmenes y están descritas 645 monografías particularmente. Cuando una planta o cuando un producto está en una farmacopea, son documentos oficiales que ya demuestran cómo se identifica el producto, cuál es la utilización, cuál es la dosis, etcétera, etcétera. Estos son documentos oficiales del Ministerio de Salud en su momento y el Ministerio de AYUSH de la India en la actualidad. Y así como tenemos las plantas medicinales, también tenemos el formulario ayurvédico de la India, compuesto, estos libros azules, compuestos por 3 textos que incluyen 985 fórmulas tradicionales, milenarias de la Ayurveda, descritas en estos libros de textos que les mencioné, el Charaka Samhita, el Susutra Samhita y el Bhagavata Decima. Bien, y también consulté a los expertos que cuando fue la reunión de la OMS, a ver si los médicos alopáticos debían estar capacitados para trabajar con remedios ayurvédicos. Y fíjense, el 70,9% de las opiniones están a favor de la capacitación de los médicos convencionales, independientemente de la capacitación en Ayurveda, para que puedan acceder, para que puedan utilizarlo para el tratamiento con sus pacientes. Y nos encontramos con una situación concreta. Me voy a referir a la Argentina, que es donde vivo y donde me he formado. En la carrera de medicina, que en este momento toma entre 6 y 8 años, en toda la carrera solamente hay 2 horas dedicadas a las plantas medicinales. Y estas 2 horas están dentro de toxicología, con lo cual justamente muchas veces charlamos o compartimos que queda en los profesionales que se están formando el concepto que las plantas medicinales son simples yuyos que lo que producen son intoxicaciones. Y entonces se pierde todo el gran aporte de la naturaleza. Y nosotros venimos de la naturaleza. A partir de esto, justamente en el trabajo de integración entre el conocimiento de la Ayurveda y la realidad de nuestro país y de Latinoamérica, hemos trabajado intensamente y seguimos trabajando intensamente buscando todas las plantas medicinales que están incluidas en la farmacopea ayurvédica de la India y aquellas también que tienen un comercio superior a las 200 toneladas anuales. Hay plantas que no están en la farmacopea, pero son de uso cotidiano. Se imaginan que 200.000 kilos verdaderamente se usa de muchas maneras. Nosotros encontramos que en este estudio que hay 120 plantas medicinales utilizadas en Argentina que están disponibles. Y cuando me refiero a disponibles, quiero aclarar que crecen de manera autóctona. Ya de la misma manera que crecieron en la India, desde siempre están también creciendo y desarrollándose en nuestro país. Esto no incluye las plantas cultivadas, por ejemplo, algo tan simple como el jengibre o la cúrcuma, ni los preparados que se pueden lograr en las farmacias magistrales. Por ejemplo, hay un grupo de plantas que se llaman rasayanas, son las plantas rejuvenecedoras, son las plantas que ayudan a retrasar los procesos de envejecimiento que según el Ayurveda van apareciendo cada 10 años. En la farmacopea ayurvédica de la India hay 53 plantas medicinales descritas con actividad rasayana. 20 de ellas crecen de manera autóctona desde siempre en nuestro país. Y por ejemplo, siguiendo en todo este trabajo, en el documento, en el ebook que hemos presentado en el día de ayer y de hoy acá en este webinar, están descritas 52 plantas medicinales que se encuentran en el texto. Y ustedes van a encontrar en el documento cuáles son los nombres comunes, tanto en Brasil como en Argentina, más allá, también el nombre sánscrito, más allá que cuando uno trabaja profesionalmente, la verdad, el documento que nos da la certeza de qué planta es ubicarla por el nombre botánico. Quiero señalar, por ejemplo, que de este ebook que estamos compartiendo, de 52 plantas medicinales que están descritas, en la Argentina, autóctonas o cultivadas, hay 40. En la farmacia se preparan con extractos o con polvos preparados de 42 de las 52 plantas. Y comercialización, a través de los diversos canales, hay 48 plantas. Para terminar, quiero señalar lo siguiente. Por una parte, estamos trabajando con una medicina milenaria. Podemos caer en el error, porque tenemos mucho para estudiar, porque les decía la vastedad, de quedarnos con todo lo que nos transmitieron a lo largo de centurias o de milenios. Pero la realidad es que, gracias a Dios, como planteaba el doctor Guita, lamentablemente la humanidad está llegando tarde a reconocer la potencialidad de las medicinas tradicionales, por ejemplo, para promover la inmunidad. Algo muy importante y sobre el cual el Ayurveda tiene muchísimos recursos. Todo el día de hoy hemos estado compartiendo sobre esto. Ahora, también tenemos que tener presente que el mundo está cambiando y todos también conocemos que esta pandemia nos obliga a transformarnos en nuestros corazones y en nuestras acciones. Y, por ejemplo, ¿cuál estamos enseñando para el 2020 o estamos enseñando para el 2030? Y acá quiero compartir un documento desafiante de una consultora internacional de organismos internacionales y plantea, ¿qué doctor? ¿Cómo la inteligencia artificial y la robótica van a definir la nueva salud? Tenemos que adaptarnos a los tiempos nuevos. En el Ayurveda, por ejemplo, aparece ahora toda la posibilidad del Ayurgenomics, el genoma ayurvédico, la personalización en aspectos muy específicos como tiene que ver con la administración de medicamentos. Pero sin lugar a dudas, sabemos que el Ayurveda nos puede dar fortaleza, nos puede dar resistencia, nos puede dar también certeza al estar conectados con el corazón para lo que viene por delante. Lo que viene por delante no lo conocemos. Sabemos sin lugar a dudas que va a ser muy sorpresivo, de la misma manera que hoy, que en este año todos realmente nos asombramos con lo que pasó. Bueno, tenemos que utilizar los recursos tradicionales mirando para adelante. Y en este sentido, quiero compartir que para muchos el Ayurveda, por una parte es un manual de la vida, nos ayuda a ver cómo nos acomodamos. Y también el Ayurveda es un diamante que, como todos los diamantes, se forja en los momentos de mayor presión, por ejemplo, de las placas tectónicas. Y particularmente los diamantes tienen una capacidad de resistencia, tienen un valor porque tienen lo más precioso del mundo mineral, y por otra parte también los diamantes tienen muchas caras y desde cada una de estas caras se puede apreciar su valor. Les deseo a todos buena salud, les deseo a todos que se sigan cuidando, les deseo a todos que nos sigamos cuidando y que para todas estas tareas, en este día de las luces, de lo que iluminemos el camino por delante, el Ayurveda lo utilicemos también como recurso para transitar. Un abrazo grande y muchas gracias por todo este espacio.
Muchas gracias, Jorge, y gracias a toda la Fundación Ayurveda Prema por el trabajo increíble que hacen en Argentina y en toda la región, y por haber sido el puente principal con el Ministerio AYUSH para poder lograr este evento hoy. Para nosotros era muy importante que este puente fuese visible entre ese trabajo que se está haciendo en la región del sudeste asiático, todo el trabajo que hace India y cómo ese trabajo con el Ministerio AYUSH se está aplicando en diferentes países a nivel mundial y principalmente en la región de las Américas. Sabemos que hay mucha información que seguramente nos hubiese gustado contar, pero en términos de los tiempos y horarios, en estos momentos para India es casi medianoche. Entonces, pues bueno, hicimos lo mejor que se podía para que todos nuestros speakers nos pudiesen acompañar en un día tan importante para ellos, con tantas actividades familiares, y sin embargo todos tuvieron un increíble compromiso para participar y estar con nosotros el día de hoy.
Natalia, quiero agradecer particularmente a todo el equipo de voluntarios que está ayudando en este momento, ayudando para la transmisión, particularmente a Cayo con todos los esfuerzos que hacen, y al grupo que ha estado respondiendo en los chats de los diferentes canales. Y también señalar que, como les decía antes, frente a estos desafíos del mundo, realmente ejemplos de trabajo como es la red de medicinas tradicionales complementarias integrativas de las Américas, de las cuales formamos parte y desde donde se está realizando este webinar, son ejemplos para el futuro, son ejemplos que convocamos a todos aquellos que quieran participar, están realmente invitados, y nuevamente ha sido un gusto trabajar en conjunto con CAPSIN desde nuestra institución, la Fundación de Salud Ayurveda Prema.
Sí, yo también quería pues comentarles a todos, detrás en el backstage tenemos equipos de voluntarios en los dos canales de YouTube, tomando las preguntas de portugués, inglés y español. Realmente hoy fueron muy pocas preguntas. A una pregunta para que tal vez Jorge puedes responder frente a dónde se encuentran los libros del sánscrito traducidos.
Estamos haciendo todos los trámites de publicación, justamente porque, a ver, estamos trabajando con el Ministerio de AYUSH por los derechos de autor. Se ha traducido por la Fundación de Salud Ayurveda Prema como actividad de servicio, pero también tenemos que ser respetuosos de todas las regulaciones sobre el tema. Y la verdad, queremos que esté lo antes posible disponible para todos, porque es para compartir.
Sí, entonces asimismo pues agradecemos a todo ese equipo de voluntarios. No los tenemos en cámara porque están conectados a través de YouTube, pero agradecemos al equipo de voluntarios tanto de la red MTC y Américas, de casi 15, 16 países, a los colegas del CASIM, muy tu brigada, y a todos pues los coordinadores de este evento. Agradecemos también, pues como siempre, a Vireme por el apoyo técnico que nos ha ofrecido, a la BBSMTCI Américas, y como mencionaba Jorge, pues este es uno más de los webinars que es parte de nuestros productos. Este año en particular, con la situación de la pandemia, tomamos la decisión de no solo estar recopilando la información y traduciendo la información como lo veníamos haciendo, sino buscar estrategias de comunicar esa traducción del conocimiento y de la información en salud, y por eso hemos estado pues haciendo estas contribuciones con los webinars, con los simposios, y siempre pues ha estado detrás un grupo enorme de voluntarios para que esto sea posible. Les agradecemos mucho. En las páginas web, tanto del consorcio como de la BSMTCI Américas, y en nuestras redes sociales, van a seguir encontrando la información de los próximos eventos. El próximo año vamos a tener también webinars mensuales de diferentes temáticas. Entonces, en los links del YouTube dejamos, en el chat de YouTube dejamos los links para que puedan seguirnos. Y bueno, muchísimas gracias a todo el equipo y muchas gracias a todos los conferencistas por haber también aceptado la invitación, y gracias a todos los organizadores.
Natalia, para despedirnos, quisiera compartir una foto de despedida. Permiso,
sí.
Un minutito. Esta es la foto de Diwali, el Año Nuevo, que a nosotros estamos terminando el año, en otras partes están comenzando el año. Que salga lo mejor de cada uno de nosotros, que seamos transformados, que ayudemos a los demás y que seamos muy felices en toda esta tarea. Ese es el deseo de todos los participantes en este webinar, y muchas gracias por la asistencia y la participación de todos ustedes.
Muy bien. Jorge, me estás diciendo que hay otra pregunta.
Perfecto.
Creo que antes de cerrar, ¿dónde se puede acceder al Vademecum AYUSH?
¿Perdón?
¿Dónde se puede acceder al Vademecum AYUSH? Pero creo que ya dejamos el link, ¿cierto? Sí.
A ver, sí, a ver, el documento que está publicado, que fue compartido hoy, está en el sitio web de CAPSIN, capsin.org.br, y está también en el sitio web de la Fundación de Salud Ayurveda Prema, medicinaayurveda.org. Y los libros de la farmacopea ayurvédica de la India, hay algunos que están disponibles en el sitio web de AYUSH y otros que deben ser comprados. No sé si era la pregunta específicamente.
Sí, igual en el pueden encontrar los diferentes links, los dejamos ya tanto de la página del consorcio como de las páginas de Facebook, de YouTube, de Instagram, todos ya están en los chats de YouTube. Y recordarles que tan pronto acabe la proyección en vivo, pues van a encontrar en los dos canales de YouTube la grabación, donde pueden dar clic en la opción de Translate, de leyendas, subtitles, para que busquen el idioma que prefieren escuchar, y posteriormente las memorias de este evento estarán disponibles en la página pues, de la BBS-MTCI a través de la vitrina de conocimiento de las contribuciones de las MTCI al COVID-19, en la sección específica de las iniciativas gubernamentales de MTCI como respuesta a COVID. Allí van a encontrar toda esta información publicada, todas estas memorias. Entonces, muchas